All right, I am in.
Whenever you're ready to start,
Great.
I
Yes,
think
I
we're
am
ready.
ready. Good morning, everyone. I'm very pleased to call the meeting to order. The time is 10:02 a.m. And it's good to see everyone. And if we could start with a roll call. Jamie, could you please call the roll?
Myra Alvarez. Dr. Burke Harris,
Yes, here.
Monica Fitzgerald,
Yes.
Shana Hazen, Jackie Majors,
Yes.
Elsa Jimenez,
Good morning, present.
Molly Munger,
Here.
Chris Perry.
Here.
Thank you.
Great. So, and it sounds like Commissioner Alvarez is going to be delayed, and then Commissioner Hazen, did she say she would not be able to attend?
No, she will be here. She is also delayed probably around 11:15 or so.
Okay. Okay. Great. Fantastic. Oh, good morning. Well, we have quite a number of items today, and I'm very much looking forward to our conversation. Number one, to follow up on our commissioner retreat that we had earlier this month, and to surface some of the ideas and conversation and build on some of the strategic vision that we talked about in that session. So I'm very, very excited for that today. I also want to reflect and give a thank you to the wonderful team for issuing a statement in regards to the ruling that came out on Tuesday regarding the George Floyd case and the conviction of Derek Chauvin, and really affirming First Five's commitment to addressing racial inequities and building a society, a community that we want to see, recognizing that an important part of our responsibility is investing and providing the systems and structures that support all children and make sure that all children have the opportunity to thrive. And so I just wanted to say thank you to the team and make a brief mention of that. One of the important things I want to highlight about today's agenda is that in an effort to create more time for conversation and discussion, we moved a few things into the consent calendar. Commissioners received an email identifying this fact, but specifically the CHIS funding, which we have done sustainably for now many, many years. We moved that to the consent calendar. And there was one other thing. Can you remind me what it was?
It's the annual report guidelines.
Yes, that's
Again,
right.
those are, I was just going to say an annual event, but that's kind of in the title. But that we work on with the association to put the details around what's going to be in the annual report.
That's right. And so if there's anything after having reviewed the today's meeting materials that commissioners want to pull out, we can certainly do that. But I just wanted to make sure that everyone was aware and also recognize the reason for that change was to create more time for us to get into some of these meaty discussions. And now I'll defer to Camille to give a quick overview of how the virtual meeting will be conducted.
So again, thank you, commissioners, for being here this morning, and for those members of the public who have joined us virtually. We will be conducting this meeting, as now we have for over a year, where the items as being presented we're asking, which commissioners already have all done, which is to mute their lines until they want to speak during the discussion. If they will either raise their hand on camera, we will notice, or raise your hand virtually. We will make sure that everyone is recognized and have an opportunity to speak for members of the public. If they will go to their raise hand function and raise that, Jamie Hastings will be monitoring that and will call upon you to make your comments. If anyone is having any difficulty accessing the virtual meeting, if you will email us info at first five first5.ca.gov. We have folks here who are happy to help you get online. So with that, I think those are kind of the rules we go by, and look forward to hearing your discussions today.
Thank you so much, Camille. And now, if any commissioners have see if there are any agenda items that present a conflict of interest or may potentially present a conflict of interest, obtaining this information in advance will ensure that I can announce your non-participation in any aspect of that item in compliance with applicable laws. Does any commissioner want to state a conflict on any one of the items? Hearing none, let's go ahead and dive in. So in our efforts to streamline the agenda, you've received the executive director and personnel reports electronically. So at this time, I want to ask if commissioners have any follow-up questions or if there is public comment on the report. So first, I'll start with if commissioners have any follow-up questions. Wow, we are the model of efficiency. Okay, looks like there are no follow-up questions. Jamie, is there any public comment?
There's no public comment at this time.
Okay, wonderful. In that case, we'll move forward to the First Five Association, the report of the First Five Association Executive Director. And I understand that Melissa Stafford Jones will be making her comment during specific agenda items. Is that correct?
That's
Yes,
correct. I'm not going to make a report now. I'll participate in the public comment on a few of the key agenda items today. It's good to see everyone. Good morning.
Wonderful. It's great to see you. Thank you so much. So we've noticed over the past few commission meetings that commissioners have preferred to comment on their advisory committee work during the specific agenda items. And we are expanding the advisory committee items to include general. So now we are expanding the general committee item to the advisory committee items to include general commissioner comments on non-agenda items. So at this time, does any commissioner want to report on an advisory committee meeting in which they participated or make general comments about anything not specifically on the agenda? Okay, hearing none. Well, I think we just heard that there wasn't any public comment, so I don't think that we need to take public comment again. So why don't we go ahead and move forward to the consent calendar? Items on the consent calendar are considered routine and will be enacted by one motion followed by a vote. There'll be no separate discussion of these items unless the commission, audience, or staff request specific items be removed from the consent calendar for separate discussion and action. Any agenda item removed will be voted upon following the motion to approve the consent calendar. Does a commissioner or member of the public wish to pull an item? Okay. And hearing none, I move that we approve I'll go ahead and call for a motion. Move to approve that we approve the consent calendar.
Second. Oh, second.
I can
Second.
move. I can move.
Jamie, can you do the roll call?
Burke Harris,
Mhm. Oh, that's me. Sorry. How can I help you? Aye.
Monica Fitzgerald,
Aye.
Jackie Majors,
Aye.
Elsa Jimenez,
Aye.
Molly Munger.
Aye.
Thank you.
The consent calendar is approved. Thank you, commissioners. And now we'll move forward to the regular agenda. The first 5 staff will present informational items, but no action will be taken by the committee. So right now we actually are gonna change the order of things a little bit. And I just wanna, what was formerly item 7, it will now be item 4. And that is the California Surgeon General's report on adverse childhood experiences, toxic stress, and health. Wow, we are making fantastic time here. This is great. That's one of my objectives, is to run an efficient meeting. So this is fantastic. So Camille and team, do you want me to share my screen, or do you have the slides and you'll drive the slides?
Whatever works best for you. We're good either way, so whatever you prefer.
Okay, why don't I do this? I'll see if I can pull it up here. Just 1 second. Thank you for your patience. Okie dokie. Let me, hang on a second.
Are we going to lunch before the 12th?
Okay, so let me go ahead. Oh, you know what? It's not allowing me to share my screen for some reason. So why don't you all go ahead and put the slides up?
We're gonna give you permission. We're at,
No.
She should already be able to. I'll just bring it up for her. Does that work?
Uh-oh.
That's great. That's fantastic. Do you want to make it full screen? Perfect. My fellow commissioners, it's really my privilege and honor to be able to share with you the findings of the Roadmap for Resilience report. This is a report of the California Surgeon General on adverse childhood experiences, toxic stress, and health. Next slide, please. So as we discussed in our last in our last meeting, in our retreat, one of the things that really drew me to the First Five, to being part of the First Five Commission, is this recognition that the work that we do is so fundamental in improving the health and well-being of children and ultimately the adults that they will become. And as we do that, we recognize that the science and the research is so powerful in this work, and it's really about applying the current science to improve the health and well-being of Californians. And what we know from the current science is that adverse childhood experiences and toxic stress represent a public health crisis. They are the root cause of some of the most harmful, persistent, and expensive societal and health challenges facing our world today. Next slide, please. And the Roadmap for Resilience report was really grounded in a very rigorous scientific framework and serves as a strong foundation for policy action to support a cross-sector systems level approach. It's rooted in the core values of prevention, equity, and rigor. And it also weaves throughout the report the impact of COVID-19. Next slide. So one of the key findings of the report is that adverse childhood experiences are causally associated with a toxic stress response. And I'll take a moment to dive into that for a second to really understand that what we're talking about. But the reason why this is important is because many of you may recall that the US Surgeon General's report laying the evidence to show that smoking was causal of lung cancer, right, was an incredibly powerful report and a powerful catalyst for policy action to intervene on the effects that tobacco were having across our society. And the strength of that policy action is rooted in the strength of the science that undergirds it. And here we have a similarly very strong finding from the Office of the Surgeon General that ACEs are causally associated. And many folks have said, oh, well, we know ACEs increase your risk of this, increase your risk of that. You know, who really knows if it's just associated? But really the data is strong enough to say that ACEs are causal of the toxic stress response. Next slide, please. And when we talk about the toxic stress response, what do we mean? Well, a lot of the times we hear in kind of the lay public, we hear toxic stress, right? Like, oh, that child experienced a lot of toxic stress. It's actually often used in a way that's slightly outside of in a colloquial way that's slightly outside of the science. When we're talking about the toxic stress response, we're talking about prolonged activation of the biological stress response system that can disrupt the development of brain architecture and other organ systems and increase the risk for stress-related disease and cognitive impairment well into the adult years. And one of the, this definition in the Roadmap for Resilience report is actually taken from a report from the National Academies of Sciences, Engineering, and Medicine, the Vibrant and Healthy Kids report, where if you haven't read it, please grab it. It's 500 pages of magic. And one of the things that I think is really important to help folks understand, when we say that ACEs are causal of the toxic stress response, I think an area of confusion for many folks is that when we look at the association between ACEs and health outcomes, we know that there's a strong association between ACEs and heart disease, stroke, chronic lung disease, Alzheimer's, depression, suicide, you know, all of these different outcomes. How can it be that ACEs are causal of all of these different things? It seems really crazy. What we now understand is that what ACEs cause is this disruption to our biological stress response, right? And it is this prolonged activation of the stress response. Those stress hormones, the cortisol and the adrenaline, they have actions on the brain, they have actions on the immune system, they have actions on our hormonal systems, they have actions even on the way our DNA is read and described and transcribed. So the exposure of high levels of adversity, they activate the biological stress response, right? And then depending on a person's individual history, right? Their family medical history, the the environment they're in, the amount of support they receive, then that leads to the outcomes the different outcomes that we see in different people. And we also recognize that although the original ACE criteria, right, which include physical, emotional, and sexual abuse, physical and emotional neglect, or growing up in a household where a parent was mentally ill, substance dependent, incarcerated, where there was parental separation or divorce, or intimate partner violence. Although those are the 10 ACE criteria that were studied by the CDC and Kaiser, we now recognize what they do. They lead to the toxic stress response. They lead to this prolonged activation of the biological stress response, and that leads to all these harms. Well, guess what? There are other things that also lead to the toxic stress response, like exposure to poverty, exposure to discrimination, like racism, exposure to the atrocities of war. So we now understand that even though, racism isn't one of the ACE criteria, it is a risk factor for toxic stress, right? And so we now understand how some of these other factors also lead to similar long-term health risks. Next slide, please. So when we look at the development of the toxic stress response, I also want to remind everyone that the toxic stress, our biological stress response is normal. It is a normal and healthy part of human development. If you don't have a stress response, you got eaten by a saber-toothed tiger, right? But the science, medicine, and researchers characterize the stress response in three different types of stress responses. There's the positive stress response. That's the normal activation of our biological stress response. You have brief elevations in heart rate, blood pressure, hormonal levels. So again, when we're talking about stress, oftentimes we refer to the stressor, but when we're talking about positive, tolerable, and toxic stress, we're referring to the body's biological response to the stressor, right? So it's the positive stress response is brief elevations in heart rate and blood pressure, hormonal levels, and then homeostasis, or the body's biological balance, recovers through the body's natural coping mechanisms, right? So that is, there's a kid at school and it's your first day of kindergarten, right? You might have a positive stress response. You might be, really, there's a new environment, there's something different, and you're going to have increase in stress hormones to be able to cope. The tolerable stress response is when a stressor is more severe, right? It can be more severe, it can be more prolonged, and the body's biological response to that stressor is more severe and prolonged. But it's a time-limited activation of the biological stress response, and homeostasis recovers. This is the most important thing. We recover that biological balance through the buffering effect of a caring adult or other interventions. So this is critically important right now during COVID-19. We are in a global pandemic. It's a time of heightened stress for everyone. But what we recognize is that with adequate buffering caregiving systems, we can keep the stress response for children in that tolerable stress range, right? And that is why having these buffering caregiving systems are so important, because if you are able to keep that prolonged activation of the stress response to a point where the body can recover, then you avoid the long-term negative health consequences. The toxic stress response is when you have a severe or prolonged or intense stressor, but you actually have a change. You have a prolonged activation of the biological stress response, and it doesn't go back to normal. You don't get back to homeostasis. You actually develop something called allostasis, which is where the body sets a new set point, right? So for example, an example would be, just a crazy example, everyone knows our body temperature is 98.6 degrees, and we use homeostasis to keep it there. So if it's a hot day, we sweat and we keep our, we use that to cool our temperature. If it's cold, we shiver and we use that to warm ourselves up, but we keep ourselves at 98.6. If we were exposed to something and all of a sudden our regular body temperature suddenly became 100.2 and stayed there, right, forever, that would be an example of allostasis. What happens with the toxic stress response is that the body essentially heats up, right? We have all these stress hormones, and the body sets a new set point for where the biological stress response will be activated, and it stays there. So it's this prolonged activation of the biological stress response. Now, the problem with that is that change in the biological set point of our stress response can lead to disruption in brain architecture, right? Increased in stress-related health disorders, and increased risk of long-term health problems. Does that make sense?
Yeah.
I'm looking, okay, got a couple of nods there. All right. Next slide, please. And even more than what happens on so we see that, and that's part of the reason why we see increased risk of, in children, it starts with increased risk of developmental and health problems, and then all the way through adults, increased risk of health problems. But one of the things that's really profound, and it really speaks to the importance of the work that we are doing, is that there's intergenerational transmission. So the adversity that the generations before us experienced can lead to the development of the toxic stress response. One of the things that happens when you have a disruption, prolonged activation of the stress response, is that those stress hormones can actually change the way our DNA is read and transcribed, right? So when we look at the intergenerational transmission of adversity, right? You have parent ACEs that lead to, you have parent ACEs, and then you also have historical and cultural trauma and social determinants of health. And those work together to conspire to increase the risk of parental toxic stress. And that is changes to stress hormones, brain functioning, immune system, metabolic regulation, and clearly when we have changes to the functioning of our brains, that can lead to changes in behavior. That can lead to lots of different factors in the parents, changes in the ability to conceive, epigenetic changes in the way our DNA is read and transcribed, right? And changes to parental health. So increased risk that the parent themselves will have physical or mental health conditions, right? And then when we look at how that affects when those parents conceive, right? We have increased risk of poorer pregnancy outcomes. And specifically, one of my real areas of interest is understanding how exposure to adversity and exposure to particularly racism as a risk factor for toxic stress, how that impacts pregnancy outcomes in Black and Brown communities, right? And then we have changes to the HPA axis of the fetus. Science has shown that we actually see changes to the fetal HPA axis and the way that the fetal nervous system is wired. And then once the baby is born, we see in children increased risk of neuroendocrine, immune, and metabolic dysregulation, and increased risk to child health, both mental and physical, as well as increased challenging child behaviors. And so the cycle goes around. And so interrupting the biology, the physiology of toxic stress is critically important. Next slide, please. So you've heard me say that ACEs dramatically lead to increased risk for 9 out of 10 of the leading causes of death in the US, right? And here we really see what the data is on the risk, right? Double the risk of heart disease, more than double the risk of cancer, 2.5 times the risk of accidents, triple the risk of chronic lung disease, and so on and so forth. So we really see a dramatically increased risk of 9 out of 10 of the leading cause of death. Next slide, please. And we recently did an analysis of the cost to California. We see that the cost of ACEs from just 8 health conditions, right? These eight health conditions over here that are asthma, arthritis, COPD, depression, smoking, cardiovascular disease, heavy drinking, and obesity. The cost to the state of California in direct healthcare costs and lost productivity is $112.5 billion annually, right? That's 1.1 trillion in 10 years. It's an extraordinary amount, and the cost just from child abuse and neglect, right, to the other sectors, including education, child welfare, criminal justice, and healthcare, is $19.3 billion. So we can see that this is what we, really would define as a public health crisis. It affects a lot of people. The effects are significant. The cost to society, both in human potential and economically, is huge. Next slide, please. And we also see that recent events really highlight the urgent need for effective buffering systems and supports. Trauma-informed systems have never been more important for recovery from COVID-19, which is a generational trauma for many people, right? We recognize that all of the disruption, all of the harm is likely to lead to increased burden of ACE-associated health conditions, right? So which can predispose for a more severe COVID disease and increased risk of death from COVID, right? But we also recognize that California, we saw record wildfires last year, right? And that is a trauma to all of the communities that are affected. And then we also see the impact of deep-rooted systemic racism in our society. And trauma-informed systems are required to prevent the long-term harms, because we know that vulnerable and systematically overlooked communities are bearing the brunt of each of these new crises. Next slide. So what do we do about it? What's the solution? How do we fix this, right? Well, the good news is that we do have some powerful solutions, and there's a lot of really excellent work that's already happening. As California's first Surgeon General, I set a bold goal to cut ACEs and toxic stress in half in a generation. I believe that we can get there, COVID notwithstanding, right? COVID kind of set me back on my first year out the gate. But we have to raise public awareness. We have to do cross-sector training. Every child and adult serving sector needs to understand how they can be part of the solution. But we also need cross-sector coordination and alignment. And of course, continued research is necessary. Next slide, please. So the good news is that really strong work is already happening across many sectors, but we need to coordinate. There's a great need for coordination. And if we coordinate, we can leverage each other's work to greater effect. And the other piece that's really important is that the work has to be rooted in science, because the more rigorous our work is, the more likely it is to be effective. Next slide. So a key finding is that toxic stress is a health condition that's amenable to treatment, right? So one of the big things that I have heard over and over again when I was launching California's ACEs Aware initiative, which is our initiative to train healthcare providers to screen for ACEs. So many people say, well, how can you screen for ACEs if there's nothing you can do about it? ACEs are things that happened in the past. Why are you asking these folks to bring it up again? And that's frankly untrue. I mean, it's untrue that there's nothing that we can do about it. In fact, the research tells us that early detection and early intervention improves outcomes, and that things like good sleep hygiene, anti-inflammatory diet, regular exercise, mindfulness like meditation, mental health interventions, experiencing nature, all of these, and I think, and of course, the most important, healthy relationships, right? All of these can biologically buffer the stress response, reduce stress hormones, and regulate, help to reestablish that biological balance. Next slide, please. But one of the things that's really important is that no single sector or category of prevention is sufficient alone. And one of the things that I want to highlight, the way that the report is divided, is that we talk about primary, secondary, and tertiary prevention. Primary prevention is preventing something from happening to begin with, right? So primary prevention is, for example, the anti-tobacco ads, right? The public education campaign targeted at youth to get them to not start smoking. That's a primary prevention. Prevent something from happening to begin with. Secondary prevention is early detection and early intervention. So secondary prevention would be something like, you know, in medicine, we think about it in terms of, often in terms of screening, right? So if you get a TB test, where you're not preventing the thing from happening, but you're doing early detection so that if someone has asymptomatic disease, you can treat them. Same thing, you get an HIV test, you may not have known that you were positive, but once you find out, you know, you can start on the therapies that are going to dramatically improve your outcomes, right? That's the purpose of secondary prevention. It's early detection for early intervention. Tertiary prevention is once something's already happened and you already have the symptoms, you already manifest some of the harms. How do we treat those harms to minimize the long-term impairment and improve overall level of functioning and improve the prognosis, right? And what the Surgeon General's report highlights is that we need to be doing primary, secondary, and tertiary prevention, or as I'll just say, prevention, early detection, and evidence-based intervention across all sectors, in early childhood, in public health, in healthcare, in social services, in education, in our justice system, in housing. We didn't cover housing in the Surgeon General's report, but all of the above. And in fact, if you go on the Office of the Surgeon General website, you'll see there is a section. We did briefs where we pulled out individual guidance for individual sectors, right? So there's a brief on the early childhood sector. Next slide, please. And some of the key things, factors that we highlighted in as strategies for early childhood are number one, raising public awareness, because as we all know, many parents believe, oh, you know, that stuff happened in my child's life, but he was a baby, he doesn't remember, right? That happened when he was little, it probably didn't affect him, right? And what we know is that early childhood is the time of highest neuroplasticity, when these exposures actually have an outsized impact on development. You know, expanding the supply and improving access to affordable childcare and home visitation. None of this will be a surprise to you. Promoting safe and stable home environments, especially ones that promote early learning and optimal development. Promoting social norms that protect against violence and adversity. improving integration of healthcare, early childhood supports, and related programs like social service across programs. So doing that integration so families can access services wherever they need to. Universal parenting education and resources. Expanding licensing and accreditation of childcare facilities and other early childhood workers to include trauma-informed competencies, and providing widespread trauma-informed training and supporting self-care for all early childhood personnel. That's one thing that's really key is wellness of our early childhood providers, right? Because it's especially when we are trying to be a buffer for our kids, right? The only way that we can do that is if we ourselves are healthy. And so promoting wellness of personnel is really important. Next slide, please. When we think about secondary prevention strategies, right? So how do we do early identification? A big part of that is, one, parent education about ACEs and toxic stress, and to teach the parenting skills to prevent intergenerational transmission, right? I have my ACEs. How do I keep from handing those down to my kids? What are the resources that I need to employ for myself so that we can break that cycle of intergenerational transmission? And one of the pieces that's really key is just to help parents recognize that they may be at greater risk because of their own history, and how do we help them get the resources that they need to be supported. Promoting positive family relationship approaches, referring kids and caregivers to an ACEs aware healthcare provider. So will you jump forward really fast to 2 slides? So one of the things that I want to highlight here is that California's ACEs Aware initiative, which is our initiative to train healthcare providers on how to screen for ACEs and respond with trauma-informed care. And that's both for child-serving clinicians and adult-serving clinicians. We actually have on the ACEs Aware website a directory of all of the providers who have who are certified and have attested to having taken the ACEs Aware training, and who have opted in. So it's not every single one, but it's a lot of our ACEs Aware providers. And so if there's someone who's working, for example, at a family childcare and is concerned about a child and wants to refer that family to an ACEs Aware provider, they can go to the ACEs Aware website and find a provider and make that referral. And it's done by county. So if we pop back to the secondary prevention slide, increasing targeted early child home visitation services. Home visitation is one of the evidence-based interventions that is demonstrated to help mitigate the toxic stress response. Supporting teen parents in graduating from high school and supporting their children. Reducing stigma around ACEs and asking for help for mental and behavioral health conditions, and providing resources to meet specific family needs, such as through family resource centers. Next slide, please. And once we've identified that not only have ACEs occurred or other risk factors for toxic stress, but they have an impact on the child, right? How do we respond? Well, we want to emphasize buffering care strategies, again, such as home visitation, evidence-based strategy, early care and education, promoting self-care strategies that buffer toxic stress, including healthy relationships, sleep, nutrition, mindfulness practices, mental health care, exercise, and access to nature. Enhancing access to high-quality healthcare services that address toxic stress, and facilitating parent mentorship programs and support groups, right? So that is the healthy relationship and modeling for the caregivers that help parents who are themselves struggling with toxic stress, and providing intensive support for families in crisis. Next slide. And so, as I mentioned, California's ACEs Aware initiative has trained over 17,000 healthcare providers across the state in the science and ACEs of science of ACEs and toxic stress and how to respond with evidence-based strategies. It's a first in the nation initiative. And we've been pretty rigorous about it. We have a statewide learning collaborative to help clinicians learn on how to do this. But this really is, I wanted to highlight this just to recognize the importance of cross-sector collaboration, right? Because when we're talking about a public health crisis, we can't imagine that the early childhood sector alone is going to solve this problem. We have to be partnered with the healthcare sector, with the social services sector, with the education sector, with the justice sector, all of the above. It really has to be a cross-sector approach. Next slide, please. And as we're thinking about how to effectively engage in this cross-sector work, right, we recognize that it requires shared language, shared metrics, role clarity, and clear lines of accountability. So what am I going to do? What are you going to do? How do I refer if I'm a childcare provider, or I run a Head Start, or how do I refer to an ACEs aware provider? And then how can I be part of the team that is providing the supports to this family in coordination with other parts of this family support network? Next slide, please. So we tried to lay out some of that shared language and opportunities for shared metrics in the Surgeon General's report. Part 1 talks about the science, the scope, and the impacts of ACEs and toxic stress. Part 2 talks about public health approach for cutting ACEs and toxic stress in half in a generation, really using that cross-sector strategy and emphasizing that we have to do all three: prevention, early detection, and intervention, right? That no one is adequate without the other. We need all of the above. Next slide, please. Part 3 really does a deep dive into some of the tools and strategies that we have done in California, including the ACEs Aware initiative, and some considerations for systems level implementation. And part 4 really talks about what the future looks like. So what lies ahead? Next slide, please. So all of this is available at our website. You all have received a copy of the report, and you'll see part 2 really includes a deep dive. So I showed a picture of the summary of what the brief pages are for early childhood, but there's a whole chapter on early childhood, and the focus is to get a little bit deeper dive on how we do this. Next slide. And that's it. And I'm happy to take some questions. Go ahead, Commissioner Majors.
Just thank you for this presentation. I think it's always helpful to know the one major takeaway, and I'm doing a parent keynote today to about 400 parents, and I don't know, I'm already rethinking some of the things I'm going to say, because really these intergenerational transmission of adversity can end. And I think sort of this cycle that we know, this cycle, this multi-generational poverty, this cycle of trauma, all of those things, I think many times some communities and some people in general, we just think that's what we're tagged with, that's it, tag, you're it, that, you got it. And I think for practitioners and for all of this, those of us working to do what we can to provide opportunities for change, I think this is just something refreshing to hear and to know that we are making an impact, and we can make an impact. As dismal as someone's situation may be, those interventions can have generational impact in a positive way. So I just wanted to really say thank you about for that. And I guess my only question that I have is, what are the things that we can do for that collective impact that a couple of your slides alluded to? Many of us do very different work, and many times we get very siloed in our work. And yet there's this cross-sectional importance, and sometimes just the conversations aren't enough, right? So any just suggestions on how we can, as individual leaders, lean into that cross-sectionality?
Yeah. First, in regards to the generational impact, I'm really grateful for your comment, and you're reminding me that I talk about the transmission, the changes to the epigenetic regulation. And one of the things that I want to emphasize is that when we get nurturant care, especially during those critical and sensitive periods of development, that also can lead to positive changes to our epigenetic regulation. So literally that can be handed down as well. And so that is really, that's something that I do think it's an incredibly hopeful message about interrupting the intergenerational cycle. In terms of what we can do, in the Surgeon General's report, there are a number of examples of efforts, like, for example, of cross-sector efforts. And a lot of them are between, for example, the justice system, the educational system, and the healthcare system. Like, there's one example of the Handle with Care program, where, you know, when police are called on scene to to a traumatic incident, right? Like a meth lab blows up, or someone ODs, or there's intimate partner violence, that if there is a child on scene, they get the child's information and they can find out where the child goes to school, right? And without sending any confidential information, they just send a thing that says handle with care. This child needs to be handled with care. And what that means is that, and I think this is especially important for our Black and Brown communities, when that child shows up at school, instead of the educators seeing symptoms of a child being dysregulated, right? Being quick to anger, throwing tantrums, whatever, instead of them saying, you're the problem, and then the child gets further chastised and punished, right? They say, oh, this child is showing symptoms of exposure to trauma. And so we all need to be part of that buffering system of care. And we can provide support and nurturing and giving the child an opportunity to calm themselves down and really be part of the solution by providing those safe, stable, and nurturing relationships. And that's something that can be done in partnership with the justice community, can be done with our early childhood providers as well, to recognize, hey, you know what, this little kid was, experienced something really scary. And so we may see some symptoms and we can be part of the solution. The biggest thing that I say is that I say educators, and that includes early childhood educators, they deliver the daily doses of safe, stable, and nurturing relationships that really are the antidote to toxic stress. And I think that the more that providers can recognize that, and especially get not just training, but also support to be able to do that, I think that is the critically important piece.
Thank you.
Commissioner Fitzgerald?
Thank you. Thank you so much for this report and the larger report we got too. And I'm curious, because obviously schools, early childhood learning centers are key partners in this. Is there conversation at the actual, and I know a lot, there's trauma-informed training happening at different teacher programs, but it's not required at the credential level to have any TPEs around trauma-informed care. And I'm wondering if that's something where the state of California is considering addressing?
So we are definitely looking at supporting and providing trauma-informed care. And I feel like the moment has never been more opportune in terms of our emergence from the COVID emergency, where I think folks recognize that there were many, many, many individuals who are experiencing trauma. Regarding the credentialing specifically, I'm not sure, but I can look into that and get back to you. Go ahead, Commissioner.
Okay, thank you. Good morning. I appreciate the presentation and refresh. Being in public health, we've learned of ACEs, I've read your book, and we've implemented the screening tool in many of our operational units. And I just want to pick up on a couple of the comments that you made, and really kind of helping us to think about the opportunities to really address the root causes or the social determinants of health. So that we hopefully help to prevent that cyclical nature of the trauma that is experienced. And really thinking about even more upstream from primary prevention is really looking at the systems that we all engage in and how are they preventing or perhaps maybe enabling some of the trauma that some of our children and families are experiencing. When we talk about like intergenerational poverty, lack of safe housing, lack of stable income. We live in, not necessarily very safe neighborhoods, because I think it's almost like we have to identify, screen, treat, and it's not just primary care providers, as you mentioned, it's really the whole system, right? Everybody who plays a role in interacting with family that really needs to be aware and help to intervene. But at the same time, when I looked at those systems, it's like, where does the business sector come into play in terms of part of that cross coordination? Where do the local government, like cities who design communities, who plan for communities, who determine what types of businesses are allowed to be set up in certain jurisdictions? And that really then kind of paints a more holistic approach to not only address the issue at hand, the acute issue, but really begin to focus on dismantling some of the structural racism that exists. Because that really then is going to help address the root causes and hopefully help reduce adverse childhood experiences, hopefully help increase reading levels at third grade, high graduation rates, and really kind of end that intergenerational poverty that many times is what puts people in situations where unfortunately they experience all these adverse childhood experiences because of where they live. And so, thinking in terms of the role of the commission and really what you're, I'm glad that you brought this here forward, but now I'm starting to think of, okay, how are we going to use this tool as a commission to begin to think about our role as a statewide commission and partnership with all of our county first 5 commissions to really begin to look at this from a systematic perspective and begin to identify strategies that we can do to positively influence and reduce toxic stress and increase some of those other outcomes that we want to achieve as a commission.
So I think that there are, so I think you're absolutely exactly right. And I agree with you 100%. And I'm going to add an and in here to highlight a nuance, right? So one of the things that I think is important to recognize is that ACEs, we see a greater prevalence of ACEs in lower income communities and communities of color. But one of the things that's actually important about the ACE study was that it was done in a very middle-class Caucasian population, right? Like 70% Caucasian, 70% college educated. And the idea that ACEs occur everywhere, right? Like that they happen in all demographic groups, and that anyone who experiences ACEs it has an increased risk for poorer outcomes. And I think part of the reason why that's important is that it speaks to the universality of the issue and the universality of it also speaks, I think, strategically to oftentimes when folks talk about low-income communities or communities of color, it's almost that by nature or by definition, those communities have poor outcomes, like it's intrinsic to the individuals in that community. And I think one of the things that looking at the ACE study and the ACE data gives us the opportunity to do is recognize, no, the difference between low-income communities, between communities of color and communities that and upper income communities and the Caucasian communities is the dose of adversity that they're experiencing. So there's nothing biologically different about Black people, right? There's nothing biologically different about low-income people that because I think that there's when we think about strategy and politics and how we use this information, one of the reasons for highlighting the universality for me is to recognize that this is really about basic biology. And then when we're talking about that, like, oh, so communities that are exposed to higher levels of, lead, right? They have poor outcomes. And so addressing lead is really critically important. So anyways, I hope that you get what I'm saying in terms of it really helps us look at how it also helps us look at some of the mechanisms of how these structural factors directly impact health, right? By saying that when you have individuals that are exposed to high levels of adversity because of racial discrimination, that profoundly affects their biology, right? And that increases their long-term health risk. And then similarly, when you have neighborhood segregation or when you have underinvestment and inadequate resources, it gives us a better understanding of how these things are happening so that we can better measure their impact and strategize as to how we can find solutions. More questions? Any other questions? Commissioner Munger?
What do you think is the best way to increase awareness?
A public awareness campaign.
Public awareness of these things that are so important for us all to understand.
Yeah. So that's a big part of the reason why you've heard me say that I think that, similar to what we've done with Talk, Read, Sing, I would like to see us directing public awareness dollars towards increasing awareness of the role of adversity in health and development, and then also what we can do about it, right? Yeah. Because I think that's the prevailing myth, that there's nothing you can do about it and it's an unsolvable problem. And I think that's not consistent with the science or the evidence.
Yeah. So you're suggesting that positive messages about this is a bad thing that's happened, but don't despair, don't give up. There's, this is something that can be, the effect of it can be very much lessened going forward. We can fix it. We can help. This isn't something that's just, we have to bury it and never think about it again because we can't do anything about it. We actually can. That message, which is very positive and enables people to take action. That was one thing that I thought was very strong. It hit me very strongly in your presentation. Don't give up. Don't
Yes,
Yeah, yeah.
that's right. And in fact, healing can begin at any age.
There you go.
Never
That's
too late to begin healing. And so
Yeah.
all of that, I think, is part of the important messaging. Any other questions or comments from commissioners before we go to public comment? All right. I see Melissa is has unmuted herself, ready to go.
I magically came back on the screen. Even I didn't know it was going to happen at that moment. So. Thank you, Commissioners and Chair Burke-Harris, for allowing me to share some thoughts during this public comment period in lieu of my regular report at the beginning of the meeting. Really appreciate that opportunity, so thank you. I did want to take a few minutes to tell you about some of the work that's underway at the local level in First Fives and at the First Five Association to build trauma-informed systems and communities across California. That is working very hard to be in alignment with the scientific evidence, the impacts, the systems and strategies that Dr. Burke-Harris has presented to us this morning. And First Fives locally have been engaging for some time in building out collaborative networks that address ACEs and toxic stress. Our work in this space has made local First Fives, I think, a trusted partner, a competent facilitator, and a leader in making those critical connections necessary for realizing an integrated, responsive system that effectively meets the needs of children and families and communities. And as we've seen through the pandemic, a trauma-informed whole child, whole family approach that is really rooted in the cross-sector systems level approaches that Dr. Burke-Harris described and that Commissioner Jimenez highlighted as well, we know is just critical so that we are building a shared context for children and families to get the supports they need to be healthy and to thrive. For example, First Five Kern County has improved community thinking and response to family members who are at risk of experienced trauma through the Resilient Kern Coalition, which offers professional training on a widespread impact of trauma and potential paths for recovery and healing. And I think Roland Mayer, the Executive Director of First Five Kern, might offer some public comment today as well, if timing allows, to share a little bit more with you about that. Another example is in Placer County. First Five, together with county and community-based partners, recently finalized a collaborative action plan that was 2 years in the making. And with this plan, the county will use publicly available data to better understand local disparities in health, wellness, and safety indicators, including those in the Native American population who have higher ACEs scores, and who have lower access points to care, and really work to improve those access points, particularly access to mental health services and to prenatal care. And this effort is foundational for the county to work towards improving outcomes and strengthening systems that support Placer's youngest children and families. And in Yolo County, First Five is serving families by implementing systems change initiatives that are research informed and family centered. They have the Child Project, Road to Resilience, which really exemplifies this systems change. And it is also rooted in further building out their existing Help Me Grow network so that there are seamless connections between healthcare providers and a central access point for connecting families with young children to services. And on behalf of Gina DeLayden, the Executive Director, I'm going to be submitting a little bit of a longer written report, a page or two, about the work in First Five Yolo that I think is really exemplifies many of the things you all have been talking about this morning. I also did want to just briefly note that Dr. Burke-Harris highlighted earlier and in her report the important role of home visiting. I'm not talking about home visiting today because you may recall I talked about it extensively at the last commission meeting, but we do continue to really see the centrality of home visiting in a coordinated system prevention, equity centered, whole child, whole family approach, and continue to work in that space and in partnership with First Five California around home visiting coordination. And like Yolo, many First Fives have foundational experience in building out networks of care in the child development field, specifically through Help Me Grow systems, where First Fives have played key leadership roles in doing that integrative cross-sector relationships and partnerships work with healthcare, education, social services, and community-based providers. In fact, several of the Roadmap to Resilience Network of Care grants are building on the foundation of Help Me Grow as a starting point for their work, and in terms of building out more comprehensive networks of care to address ACEs and traumas. And the association helped counties ramp up their Help Me Grow systems, as well as help coordinate amongst them for opportunities to learn and to share about how this work could be strengthened and expanded. And while County Help Me Grow systems have been successful, one thing I did want to share and note with you all is that they were also built, those systems, somewhat separate from the healthcare systems that they support, particularly Medi-Cal. And I think we would observe that that has limited at times the scale and the reach to all children and families who would benefit from the Help Me Grow system of developmental screening and connection to a variety of resources. And so we are very excited to see that the network of care grants offer an opportunity to maximize cross-sector integration and directly coordinate with the healthcare system from the inception. Connecting the dots across those systems and creating on-ramps into it in a way that is really sort of touching all of the parts it needs to. From our experience in Help Me Grow, building robust networks of care like that, including services to which provider can refer patients, will add an incentive to healthcare providers to conduct the ACEs screening, which of course there is the incentive payment, but having this network of care is a real complement to that effort. And we really welcome opportunities to continue to partner with First Five California, with the Department of Healthcare Services and others to further explore how community-based networks of care can be more fully incorporated into the policy, the reimbursement, and the delivery system frameworks of Medi-Cal, given the tremendous potential for improved short and long-term health outcomes for children that that approach could provide. The network of care grants facilitate First Five County Commissions in bringing together community partners, organizations, initiatives, as I mentioned, including Medi-Cal providers and Medi-Cal managed care plans, to really create and build these collective impact approaches. I also think we've noted the power that Commissioner Majors was talking about in collective impact, and how is it that we take those to the next level to address and reduce the intergenerational transfer of ACEs and of trauma. Just to share, in terms of those network of care grants that are coming out of the Roadmap to the Resilience report, there are First Five counties with network of care planning grants. That includes Glenn, Kern, Merced, Placer, Santa Cruz, Shasta, Sutter, Tehama, and Ventura. And they are all currently engaged in a process to better understand their local landscapes, identify key partners that can come together to co-design the networks of care with, and then putting in place a planning process to build the component parts of that infrastructure needed to put in place the network of care. And then there are First Five County Commissions that are deeply involved in implementation grants for the networks of care, which includes Contra Costa, Los Angeles, Orange, Sacramento, Sonoma, and Yolo. And they are building on established partnerships in their communities that are addressing toxic stress, ACEs, and mental health within the healthcare and social services realms, as well as partnering with community-based organizations using peer-to-peer support opportunities, training, care coordination, and capacity building. And we know this work will really put in place the infrastructure needed to connect across these critical health and networks of care systems that are there. We also know that successful networks of care require robust local level partnerships, which these new grants clearly catalyze. They also require state level funding and policies that incentivize equity. And the association brings the experience of County First Fives to our state level advocacy efforts to try to inform those state policy discussions, and wanted to share a few things happening in that space right now that I think is very directly connected to this work. For example, we recently authored with a group of partners a budget request for early child mental health consultation funding, which is directly related to the gap we see in networks of care. There are too few early childhood mental health providers to meet the need even before the increased family stress brought upon by the pandemic. And we really, as was described in the presentation, thinking about how do we in the early childhood setting, in early care settings like childcare settings, support those childcare providers in seeing and then addressing and having the support they need to help parents and the childcare providers themselves address the early childhood social and emotional wellness needs that we are seeing for children that we know are going to, unfortunately be much more extensive as we returned back to opening up post the pandemic and begin our recovery together as a community. First Five Association and our county commissions also recognize the value of collaboration with one another and with partners lies not only in sort of maximizing our collective brain power, leveraging resources and synchronizing efforts to screen and treat, but in addressing all of the elements that contribute to stress and trauma and in preventing them from taking root in the first place. Really along the lines of what Commissioner Jimenez's important comments were, this is about addressing the circumstances that lead to toxic stress and trauma in individuals and families and across generations. And we know it's not enough if people are in community environments that create, reactivate, or perpetuate trauma. The tentacles of racism and inequity reach into community environments and systems in ways that not only perpetuate the racism itself, but understandably perpetuate fear, depression, and mistrust. And to truly address trauma, we have to cut it off at those roots as well. And the First Five Association and county commissions are increasingly seeking to address these issues at the systems level and really hope to continue to deepen our partnership with First Five California in these systems level efforts. And sort of let me close with a few final thoughts, and that is that we know that the whole child, whole family approach recognizes that children cannot fully learn and develop without addressing and understanding the context in which they live, and that a child's optimal development requires secure attachment with adults, stability, and loving interaction. And these ingredients are found within families that are stable and resilient and that are bolstered by community and environmental supports. And we really look forward to working in partnership for public policies being put in place that address the overarching impact and pervasiveness of structural racism that can disrupt those family and community stabilities and hamper the health and well-being of our young children. And we see that healthcare providers and the health systems as a critical sector to prevent and mitigate trauma. And for low-income children, the healthcare delivery system we all know today is not meeting the needs of our youngest children. This year, California has big opportunities to improve healthcare for children on Medi-Cal, most of whom are children of color, through new contracts with Medi-Cal Managed Cares it's working on and through CalAIM reform efforts to Medi-Cal. For example, Medi-Cal Managed Care plans could be obligated to create specific health equity plans to address inequities and disparities, including access to community health workers, doulas, and home visiting, and be held to specific goals to reduce, for example, birth outcome disparities that disproportionately affect Black families. To foster healthy children, we must build a resilient safety net to prevent and mitigate the impact of toxic stress on our most under-resourced communities. And this requires unearthing racism in all its embedded places and forms, through reevaluating everything with a critical eye, seeing things as they truly are, and calling it out. And I know that is work that we at the First Five Association and First Fives are working to do. But it also means continually holding the vision of what you all, the commission was talking about, of what can be, of the hope for what is in front of us and what we can create together. Communities with healthy and safe physical environments, conditions for shared economic security and mobility, access to lifelong learning, education, and employment, and opportunities to connect with one another. And we look forward to working with you and our partners to make this vision real for our youngest children and their families. So thank you for this conversation and this important work today.
Thank you, Melissa, so much. It's very powerful. It's exciting to hear all of the excellent work that is happening across the state. That's amazing. Thank you. do we have any addition? I want to ask the question if we have any, if whether the commissioners have any questions. But also, do we have any additional public comment?
Yes, we have Monique Segura. She's on now.
Great.
Hi there. My name's Monique Segura. I am with the California Teachers Association. I am an appointed liaison to this committee. And I apologize that it's been rough to get here with my teaching schedule. I'm a kindergarten teacher in Santa Maria, California. I was able to be at this meeting, and I just want to say, Dr. Burke-Harris, I am an educator, not a scientist, and I had tears in my eyes watching your presentation to hear the science to what I see, in my classroom all the time, and gives me such great hope listening to your presentation. And I also, on a side note, I have 3 daughters that one was in my kindergarten class 20 years ago. My husband and I adopted when they were 4, 6, and 7, who experienced trauma. And I look at a dark cloud that we just kind of keep chipping away and giving them what they need. But I really would like to know the commissioners to know that the California Teachers Association has been working very hard on this exact topic in terms of working on discipline with our students in our classroom, on educating our teachers, our 295,000 teachers in California. And so I am hopeful that Dr. Burke-Harris, we can work with you to maybe have you come and present to our educators, because those of us in the trenches know that our children need better, and we need to be educated as a collective force to understand what our students are going through, especially our Black and brown students in the state of California. So I will email all of my information. I've been part of this to Camille, but I think this is an integral time where we need to get together and work. And one of the other things that I just want to share with you is, having taught kindergarten during this pandemic on Zoom, I see in homes exactly what is happening. And you hear about it, you talk to the parents, but I am seeing I have 30 students, and I am Zooming with half and half in the morning, half in the afternoon. I just started back face-to-face with a group in the morning, but I still have students on Zoom in the afternoon. And I am seeing directly what is happening in these homes, and the realization, and even the noise level, and what these children are enduring. And we need to do better. And I think this is a pivotal time in our society. And just thank you so much. And I hope that Camille will share my contact information with you, Dr. Burke-Harris, and that we can hopefully get you at some of our CTA conferences to get this out there and start this public awareness campaign on the grassroots. So thank you.
Thank you. Do we have additional public comment?
I don't have anybody else signed up.
No. No one else at this time.
Oh, hold on.
Oh.
Somebody was, yeah.
Wait a minute.
Roland.
Roland.
Okay.
Sorry. I wasn't sure how to do that. Thank you. I'm Roland Meyer, the Executive Director of First 5 Kern. A couple of you I have met. You've been to Bakersfield. You had Bass Food and Dwarf Shoes, and so you're gonna figure out Kern County. No, we were one of the recipients of the latest planning grant, and we're really excited of what we can do with that. We're working with over 50 organizations, including 3 of the Medi-Cal managed care entities, 2 large FQHCs, Omni and Clinica Sierra Vista, which has a big presence in the Central Valley here, to achieve the following 3 major objectives: to greatly expand the number of trained local Medi-Cal providers who screen for ACEs, toxic stress, and related medical conditions, provide advice, treatment interventions, and referrals for supportive services, to partner with the Kern Connected Community Connection referral system using the U9S platform. I think that gives us a great opportunity for a referral service. We're optimistically hopeful that it will work. To connect medical providers with local community services and not have to keep inputting the same data over and over and over, which has always been an issue. And then third, to work with community leaders to identify and implement broad strategies to overcome racism and ethnic bias that negatively impact the health of so many families. And our work in Kern began around 2016. We had a consultant, Mark Tebow, and we brought in Dr. Lisa Conradi from the Rady Hospital in San Diego to do a cohort of about 100 people. We did 2 years in a row to 4 all-day sessions. It was education. And the main theme of what we were teaching or we tried to instruct is that when we go into situations with families and kids, it's not what's wrong with you, it's what happened to you. And it's that lens that we want to impact and make it every day a sense of what we're trying to do. And we started out with Trauma-Informed Kern County. We have a leadership committee of 15 public and private county organizations. So we've trained over 200 people and over 50 organizations and really looking at what are they doing internally? How do they reach out to their providers who come in, their clients that come in? Is it welcoming? Is it well lit? And what we found out also is we also need to work with our providers on wellness. Who do they have to talk to? How do they get together? And self-care is so important. So I wanted to say thank you, Dr. Burke-Harris, for allowing the grant. And we were done with deliverable number 1. We did an assessment of our county. And I think we're in a pretty good place to move into the implementation, but it isn't about the money that we receive. We have to get to the point where this is about things we have to do, no matter where the money comes from. We have to make it work and be a part of what we do on an everyday basis and integrate it into every facet. And we're hoping that this can really move into other programs we're funding, like Nurse Family Partnership, Black Infant Health, and then to Help Me Grow. So they all shouldn't be separated. They're all a part of a network of care that needs to be integrated when we talk about care. So we're excited. I wanted to keep it brief because I know you have a big agenda, and thank you for the opportunity.
Thank you so much. It's wonderful to hear about the exciting work that's happening in Kern. All right. And if there's no more public comment, I'm okay. Great. So we are a bit ahead of schedule, which is great. It's 11:30 right now, which means we can, I'm looking at my fellow commissioners, we can go ahead and jump into the follow-up to the retreat discussion and then perhaps take a break after that. Does that sound, do people have the stamina for that?
Can I just suggest, Janelle is not here yet. She's in another meeting and is a time certain for us at between 11:45 and noon. She'll be on. So I didn't know if possibly, if you didn't want to take a break, maybe we could do the financial update. And
why don't we do that? Yeah, why don't we do the financial update and then we can take a quick break and then jump into the retreat discussion.
Perfect. Thanks. Yeah. Oh. So we're going to get Marcia Thomas. There she is for the financial update.
There we go. Can you hear me?
Yes.
Yeah. Okay. Good morning. It's a pleasure to be with you all today. This will be a short report, as little has changed since we met in January. However, I do want to provide a quick revenue update for you. We received the Proposition 10 revenue for the month of February, and it was lower than anticipated. The net revenue available to transfer to the California Children and Families Trust Fund, once California Department of Tax and Fee Administration adjusted for administrative costs and statewide assessments, was $7.5 million. Of this amount, $1.5 million is allocated to the State Commission. To provide a little comparison, looking at prior fiscal years and the current fiscal year, the average amount available to transfer was approximately 25 million, with 5 million going to the State Commission. In looking at past revenue trends, we always anticipate November to be a lower revenue month, but we did not expect February to come in low as well. So in our conversations with CDTFA, a couple factors contributed to the lower revenue amount for February. The number of days in the month for February was an impact. Let's see, credit stamp purchases and cigarette and tobacco tax returns are due and reported by the 25th of each month. The 25th for February was Thursday, so it gave one processing day, the 26th, one business day. In shorter months, this does not allow sufficient time to record, process, and remit the purchases and revenue to the State Controller's Office by month end. Sorry. This revenue at month's end is considered in transit to the State Controller's Office and not captured and recorded by SCO until the beginning of the following month. Therefore, the February in transit amount will be included with the March revenue transfer. It doesn't happen very often, but like I said, February had very little days for them to process it, had one business day. The second factor is the cigarette stamp purchases were higher in previous months. So in looking at prior months' activities, December stamp purchases were higher than previous months at 38 million. And then January was also on the higher end at 32 million. The assumption is there's still lingering stock and there was little need to purchase additional stamps. This is only an assumption, and CDTFA will continue to monitor and keep us informed on the revenue patterns for the coming months. This quarter, we provided the financial plan, attachment A, the fund condition summary, attachment B, and then we also put the PowerPoint presentation from the January's commission meeting in the package. The PowerPoint was included as an informational piece for reference. We did update the last chart on the last page of the PowerPoint. That has updated figures that matches the fund condition summary. So it's up to date. We are looking forward to the May revisions from the Department of Finance, and we'll share that information with commissioners at our July commission meeting. Before I answer any questions, I wanted to introduce a new team member to the Fiscal Services Office, Julian. I don't know if Julian is going to be on board. I don't see him. No?
Looks like he's here.
Okay. Well, this is Julian. I don't see a picture, but Julian comes to us from the California Department of Public Health and has a background in finance and state budgets. Julian is replacing Lori DiBartolo, who was with First Five California for many years and recently retired a few months ago. As we gear up for the fiscal year end and the new budget year, I'm really happy to have Julian on board to help me. So that is Julian. And that's all I have for today. Sorry, I was a little nervous. I didn't expect to go up so soon.
Well, thank you. You did a wonderful job. Sorry, go ahead.
Does anybody have any questions for me? Hopefully I didn't rush through it. I'm sorry. No?
I do have a question, actually. Okay. I wanted to give an opportunity for others to ask. So I wanted to understand in terms of the lower February receipts, right? I understand that February is a shorter month,
right?
But I heard that the finance team did not anticipate that February was going to be lower, right? And so the number of days in February is pretty much the same every year, right?
Yeah, it is.
I want to understand, and the difference between 5 million and 1.5 million is substantial.
It is.
And so in terms of the factors that account for the difference in receipts, I want to understand that a little bit more of what you all think is going on, because I'm imagine that I heard a couple of things, the number of days in the month being one of them. But the other piece is I wanted to understand a little bit better. I don't know enough about the stamps of what is the significance of the greater than normal purchasing of stamps and the number in the months ahead of time. What does that, how do you interpret that? Like, what does that mean? I actually don't know that much about it.
Yeah, so the distributors actually purchase the stamps in advance, right? And so I'm trying to pull up my spreadsheet really quickly. It's usually not that drastic of a change, right? So they purchase, it runs anywhere from 25 to 30 million.
Mm-hmm.
And then this month, February, was low. So in talking to CDTFA, they don't know if the fact that it was so big in December and January, like they don't know what caused that big increase in the purchase, right? But it's kind of unusual because in looking in last year, they didn't purchase that much. It was kind of even. But for this reason, for this year, they purchased more. But there's not really a clear explanation yet why.
And could you just clarify I assume maybe I'm the only one who doesn't know this, but just in case I'm not, like, what do the stamps do? Like, why do they, how does the purchasing of the stamps impact our revenue? Like, what are those stamps?
So the cigarette stamps is something that distributors purchase from CDTFA, the California Tax and Fee Administration. They purchase it from them and they affix it on the packages going out, the cigarette and tobacco packages. So they stamp it and that's kind of like their tax. That's how they pay their taxes, by buying those and affixing it to the tobacco products. So that's what it is. Does that kind of clarify a little bit?
That does. Thank
Okay.
you. I had no idea what you were talking about, but that makes
Sorry.
And it also cuts down on fraud, right? So
Yeah,
there
it
are
does.
counterfeit
It does.
products that go out that aren't stamped, which we don't get revenue from. So it's a way of controlling
Got it.
product.
Yeah.
Very
Yes.
smart.
Yes, yes. But yeah, it was a lot higher in the last 2 months. And I looked at December and January of last year, and it wasn't that high. It was pretty stable. So I'm not really sure what drove that to happen this year. They don't really know either, but that's why we're assuming there was such a low purchase in February. So.
Great.
Yeah.
Marcia, we're anticipating though that March will be higher, right?
We are. So whatever didn't get remitted that was kind of in transit, because I was looking at February last year too. There was like 3-4 business days, I think, towards the end of the month. So it allowed them a little bit more time to get that through. But for this month, we literally had one day, or they had one day, not us, but it was Thursday that was the deadline. So they had Friday as a business day to process it. So that funding kind of is considered unremitted until SEO gets it. So SEO wouldn't get it until that following business day, which would be Monday.
So while it's a shorter month, it's mostly where it lands on them being able to process. So if the 25th lands on a Tuesday, you might have 3 or 4 days.
Right. Right. Yes.
Commissioner Hazen?
So I just want to make sure I'm understanding correctly where we are. So is it correct that typically in an average month, in an average year, we would see $25 million per month. But this February, there was a total of 7.5 million. What did you said that I believe November and December were higher than usual? So does that mean how high were they above the 25, and does it make up for the significant decrease we saw in February? So what I'm trying to understand is, did distributors purchase their sort of February allocation early, maybe because it's a different tax year, maybe something to do with sort of their fiscal strategy, who knows? But what did November and December look like? I can't recall.
So November and December, let's see, December was like 38 million that they purchased. And then January was 32 million.
Got it. Okay.
Yeah, so what was purchased in February was 8 million. So there was quite a difference. And it's an assumption and a speculation, right, of why it could have happened. We really don't know. And until CDTFA does their reconciliation, we won't know like what the additional is. They're anticipating that 10 million would, be captured in March of
Yeah, but
February.
it sounds like if you were to do an average of those 3 months, we're not so far behind. Is that?
Not so much, but it's more about like November, we expect it to be a lower month. It always is. It's kind of every year we know we're not going to get that much revenue. How much will we get? But February usually is a stable month. So it's not so drastic. I think that's what kind of threw us for a loop a little bit, is because it was so low. So we'll continue to have conversations with CDTFA just to kind of monitor the trends and make sure. But yeah.
Thank you.
You're welcome. Any other questions? No? Well, thank you very much. I'm sorry I was
Sorry, Marcia. Not a question through the chair, just a comment. I do look forward to future discussions regarding plans for perhaps looking at our year-end balances and just opportunities to be able to identify new strategies that could be implemented that are in line with, the buckets, I'll call them buckets, right? Education, childcare, et cetera. Because we do have, it's a very good position to be in financially to have such healthy fund balances, and really what an opportunity we could explore in terms of addressing as we move from COVID response to recovery efforts, and knowing that a lot of that work needs to be done at the local level, and what role the State First Five Commission can play in helping to expand services, collaborations, training, really equipping our providers and our families with the tools that they need to be able to be resilient and move through the recovery phase.
Yeah, we're waiting for May revise to see how that comes in, but yeah, we're very excited to have those conversations as well. And hopefully we'll have like a good presentation of where we are and start those discussions, within the next quarter, at least, be ready by July. But I'm not sure if, Camille, do you have anything to add on that?
Yeah, I think as we look at the fiscal picture, as we go forward today with the next discussion around what was the retreat and what we're looking at as a North Star, and then lining up, as you've said, Commissioner Jimenez, on our investments, what we have to, what kind of funding is available to us, and then listening to the Dr. Burke Harris's presentation this morning. I was checking off the, yes, we could invest, we could be in there, we could do this, we could do that. So I think those conversations will take place shortly. So, good.
Thank you.
Thank you.
We have no public comment on the.
I've got one more.
Okay. Sorry.
Just a quick process question, Marcia, about the slides, because I think they were helpful at the last meeting to understand where we are. And so you said that the last one is updated. Is that correct?
Yeah, that's the only one that we updated, so it would match the fund condition summary of this quarter. Okay. So we updated the numbers, and that was about all that we changed, because we were hoping to have a better presentation in July incorporating the May revise.
Okay, because I'm wondering sort of what's realistic to expect moving forward, just sort of the standard that we receive at each meeting. So it sounds like maybe the last one. I'm wondering, the one that 6-slide proposition tax revenue for July through November, would it have been possible to update that one? Because again, as we were describing February to February, if we could have actually seen what, sort of the 1920 and 2021, could have been helpful.
Okay, I'll definitely make sure that we do that next time and add that in there. And that's a good point. I didn't even think about it. I was more trying to make sure the last page was updated.
Yeah, I appreciate
I appreciate that.
Thank
but yeah,
you.
there'll be a slideshow presentation for the July.
Terrific, thank you.
Thank you.
Chair Burke Harris, if there's no other comments from commissioners on this, Janelle has joined us. So I don't know if we want to just go ahead since we have her for limited time, or if you want to take a break, but just letting you know she's here.
Thank you. I had been thinking that we would take a break. I want to look. I'm looking at people's facial expressions as I say that. How are folks feeling if we were to take a brief 15-minute break and reconvene at noon? You mentioned that Janelle has limited time. I want to make sure I'm understanding those considerations.
Yes, she will be here with us until 1 o'clock.
Yeah, I think we're on schedule to do that. So let's take a brief break from 11:45 to, or 11:47 to 1 o'clock and reconvene promptly, not 1 o'clock, at noon, till noon, and reconvene promptly at noon. All right. Thank you very much.
Thank you.
Welcome back, everyone. Everyone is very, very prompt. I think we're waiting just a few more moments for Camille and the team to
We're
join.
good.
We're good.
We'll
We'll
good.
be on video shortly. I promise. We're here.
We're here. Can you press the video camera?
Our video needs to be on.
I'm sorry. That's okay. That's okay. Here we are.
Do you need more?
No. Okay. So welcome back. Dr. Burke Harris, we're ready to move forward. Janelle, I see Janelle and Monica both here. So if you'd like, I can start off by introducing them and a little recap, and we'll go. Is that all right?
Sounds great. Thank you.
Okay. All right. So again, thank you all for coming back. As Dr. Burke Harris said so promptly, we have, as of the April 1st commission retreat and all the conversations that went on there, you have given the staff a lot to think about over the last few weeks. And we're excited to come back and continue that conversation with you today. You talked about last time, and we'll talk about again today, you know, our continued work at First Five California, the development of the North Star, and what's become now a common term here, a big, hairy, audacious goal, or a BHAG, that we are looking at that'll guide our work in the coming years, and working with you to decide exactly what that is. So we've taken the information and direction you shared with us on April 1st and have begun to put that into action. And so we want to share where we are today and make sure we're headed in the right direction, and also talk about the next steps in this work. We are so grateful and appreciative of the work that Janelle Kubnik and Monica Mathur-Kaluri from WestEd have given us over the last few weeks, and are joining us again today to help lead this discussion. So I know there's a lot to go over, Janelle, so I'm just gonna turn it over to you.
Okay, well, thanks, Camille, and thank you, commissioners, for giving us another opportunity to come back to you post-retreat. As Camille said, it's been 20 days, but a lot has been done, I think, in terms of immediately taking the inspiration that you all provided. And I think the call out of where are the things, that cognitive dissonance around feeling really connected, and then looking at the words and saying, where are all these pieces? So it's been a really, I'll say, productive, challenging conversation to have over the last few weeks. And I think really happy to be here with you today so we can share out, hear from you, and further refine. So on the path of I'd say, the commitment to strategy matters and execution is important. So how do we communicate the right ideas, and then how do we make sure that we're using that plan effectively moving forward. So I'll turn over to Monica to do a quick recap of just reminding you all where we were on April 1 and what came out of that discussion. And then we'll transition it over to Jackie, who, you know, we can say her birth at First Five, it follows along the trajectory of this conversation. So she'll bring back to you what the staff reflection is and recommendations, and then we'll look for your feedback. So Monica.
Great. Next slide, please. Thank you. So I'll start us back at that strategic planning meeting that Janelle just mentioned on April 1st. And if you remember, we asked you then about what do you care about and your whys. I think another term we used was your care abouts. And so here are a few statements from that meeting. It may not be the most impactful thing you said, but a few comments from that discussion just to get us back into that discussion. So comments such as, I saw what poverty does. Always consider African Americans. I'm grateful and motivated. Another commissioner said, need a supportive system for each child. Another, proud representative of Mexican immigrants. Our chair, Brooke Harris, said it's not okay to not talk about widespread trauma and things we can do. And finally, Commissioner Munger said, I hate injustice. Next slide, please. So these were just a few comments. And if you remember from there, we tried to align these care abouts, all of those things that we heard from you in your whys, and tried to align them with the areas that the First Five staff highlighted. And that's those rectangles there. And although there were some that aligned really nicely, we talked about how many of your whys were actually on the outside of the big rectangle and didn't completely connect. Your whys that were really focused on things like advancing racial equity, social justice, and reducing the impact of ACEs and toxic stress. And I see the one note here where Commissioner Jimenez stated that where each child is given an opportunity to reach their fullest potential despite race and place. So really looking at that being the overall. And the last just quick comment I'll highlight is your strong message about focusing on systems. Systems that truly invest in communities of color, those living in poverty and experiencing ongoing multi-generational trauma. Chair Brooke Harris said something that I'll never forget, which was about we can cure cancer, and yet here we are with trauma and we know how to prevent it and we're not. So that was a definite moment to remember from that meeting. And along with this guidance about the areas of focus that we should continue to think about and the what we do, you also left us with some clear direction on the how. And that's what Janelle is going to review next. So next slide, please.
And so, you know, I think this is where, as we left that retreat, what was the link back to staff and the direction back to staff? And I think clear messages from you. One is be bold. We're not here to just make incremental progress. We're here to really address and attack a significant need, an urgent need. And so there was also comments around, let's do something for which we have a unique ability to address. So this gets to sphere of control, sphere of influence, you know, so there are big problems out there, but where's the First Five role? Where's the place that First Five can uniquely be serving and doing it, recognizing in partnership? So this means being strategic, thinking about where the First Five places. There is I think, real clear call out of, you need a strategy, we need a strategy, we need to have a clear North Star, we need this to be measurable, and it needs to leverage those strengths that we see for the commission. And then another key piece is, let's be about the moment. We are in a time that is unlike, you know, go back a year ago, go back 10 years ago. This is not the same time. So what we have now, we have alignment that we're starting to see amongst our local, state, federal governments in terms of attention of public investment, the value of that, the importance of that, derived and based on something that First Five has been championing for years around early brain development, around protective factors, around breaking the cycle of poverty and thinking about whole child, two-generation approaches. So this is a moment unlike anything we have seen before, where we have a chance to think about how do we use the powers, the strengths of First Five to champion these areas that are now receiving national attention, and in some ways are catching up to all that we've been promoting and knowing as a commission. And then finally, really key to that is be focused. So this came through loud and clear. Is there's a lot of things going on? How do they connect? What are they working to get done? And while we can, be bold, strategic, and about the moment, let's be about something important. Let's be about something that allows us to show with clarity how we're building for a better whole for the system. And so these are all things that help frame what became the staff conversation, which became the way of what we're going to share with you here today of mapping a concept for the North Star. So I'm going to turn it over to Jackie and let her share out what staff has been processing through and accomplishing over the last few weeks.
I was trying to sign my presentation, but that clearly was not working. So thank you. This is a birth project for me, as Janelle has indicated, and I think I'm a little bit of a preemie. So within the first 22 days, but I can walk away that there was a lot of energy and a lot of excitement from staff after the retreat, me included, right? It was clear this commission's commitment to equity and justice and really making transformative change and align that to big transformative goals. Right, so we were inspired by the stories of commissioners, because I don't think historically we've been able to understand the root causes, the why that you are here. And it actually also allowed us to actually become in touch with our own why here. There are people who've been here for decades from the inception of the commission. And so just really kind of taking the ability to repause and rethink our commentary why. So I want to just first thank you for that and appreciate kind of the clear voice that even though all the commissioners come in with different strengths and different stories, that there was a very clear similarities in why you are sitting on this commission, why you were appointed today. So, and we also are very clear that and inspired that our why needs to really guide our direction in every single thing we do. Right. We have found that we were, as we were digesting and processing the retreat, is that we need to tell a more engaging story about the work we do. Sometimes I think we get bogged down. I'm seeing some nods from the commissioner by the jargon, by the words, and become overly academic, and it loses its impact. So we heard that really loud and clear, that we need to make this North Star very clear, very simple, so that it's this evolved North Star, I'm going to say. And so, and we know that we have a lot of strengths and can build upon that history, her story, I'm going to say, the investments that we have, since we have, predominantly female-driven commission. And I'm proud of that. And so, so we have next slide, please. And so that is kind of our reflections back from staff. Just a lot of energies. So as we embarked on this approximately 20 some odd days ago, we were thinking about how this aligns with the strategic plan. We went back and forth. And really, this is about like the compass. When we talk about a North Star, it isn't ever about kind of getting to that North Star. We think about our directional path, our directional pull, right? So I think we as staff were thinking, oh no, it's home visiting, it's DLL, and Janelle so adequately said, nope, let's step back. Let's talk about what a North Star really is, right? What is that pull? What is that drive? How are we going to get there, right? So, this is actually what we created together, is that, again, this is what we heard in the retreat, is that identifying our levers and what is our theory of change, our actions, and specifically our theory of change is revolved and a continuous cycle of improvement around investments and policy priorities that we identify, right? And how does that impact the outcomes of child and family outcomes, as so eloquently kind of laid out before, if we so choose to kind of take on ACEs as this core function, like what is our goal? I love this concept of epigenetics, right? Like how do we disrupt or change kind of the next generation of folks of trauma-informed practices and whatnot to lead towards our big North Star. And quite frankly, it's the evolution of what we've done in the past, right? The evolution of talk, read, sings, which was really rooted in the neuroscience of what that does from 0 to 5. And we're, you know, some people think, oh, we're getting rid of it. No, we've actually always been rooted in this concept of impact of 0 to 5 and the brain development of young children, right? I love this concept of, or this theory of toxic stress, right? Like understanding poverty, homelessness, right? That impacts children even in utero, right? So the toxic stress of poverty in utero really is aligned. But then, you know, stepping back, Janelle saying, okay, Jackie, if you can solve poverty, great. I'm like, I think I have a plan, but that's my old job. In terms of our job here, what is our 0 to 5 framing in impacting that, right? So, and how do we get there? So next, please. These are the 5 levers we have identified at First 5, right? We advocate and educate, right? The things like we have the flexibility as a commission, right? To actually invest in, again, an education campaign. That last, you know, the last iteration of this was Talk, Read, Sing. The next iteration of this could be the ACEs Aware, right? And I pose this as a question because we want to have a conversation, a dialogue with the commission about being really clear about that directional pull, right? We value our relationships and our partnerships. We are conveners, connectors, and leaders for parents and communities and other state agencies and the First 5 network, right? Grassroots, right? We also have resources and we are funders and we have expertise and flexibility in funding certain things. We also have a unique brand, right, in this space. And this is what I'm really excited about, is kind of embracing a lot more, is we are a catalyst, right? We have the ability, because of our flexible funding, to spark innovation, right? What does that really mean? You know, I hear a lot about dwindling resources, and you all know, like we were talking about the stamps and all of that, right? But but the truth is, okay, with limited resources, what is our purpose? Right? What can we do that creates innovation and systemic change? So this is what we had identified as First 5's levers. But I want to also say that relationships with what you all bring to the table, right? There is a wealth of power sitting on this commission, a wealth of influence. So how do we become ambassadors of whatever this North Star is in all of our capacities, right? And so next slide, please. Not next slide? Oh,
On the next slide, it must be behind.
It's behind. Okay. So the slide is stuck. And so the next slide is about identifying our current area priority goals. And I know that you have that in front of you likely. And so our current priority areas, as you all know, are child health, child development, and family function. And as I was taking a lot of notes during our first presentation from Chair Burke-Harris of like, throughout this, there are kind of toxic stress implications throughout every single area, right? How do we, that's okay. That's okay. How do we raise awareness and change the hearts and minds? I remember I was on a Blue Ribbon Commission, and we were talking about changing the hearts and minds of communities. And that requires an investment in what I say, marketing. I think we've had a lot of questions about why do we spend so much budget on the advocacy and marketing? The truth is that we need to make the ground fertile for understanding of the impact of this work, right? And that's why, but until people understand and know what that is, and it needs to be in accessible language, right? And understanding. And I'm not just talking about linguistic. I'm saying it needs to be, we told Janelle we're going to say this, right? That Janelle's grandma, right, needs to understand what we're trying to do, right? We can talk about epigenetics, we can talk about ACEs, we can talk about trauma, but Janelle's grandma might not be able to understand what that all means, right? Or my mom. Sorry, Janelle, I don't mean to use your mom, but we did prep you to say that we're going to do that. And so as we are going through these current priority areas that will be aligned to a North Star, what does that mean, right, for us in the primary, tertiary, and secondary levels, right? And how can we, because in all of these areas, I would say that there are interventions that we can enhance, uplift, and even invest in as towards this North Star. Next, please. To that end, we're talking about our superpower, right? The ability to touch lives all across California at 0 to 5, all the caregivers, right? So here's the thought, right? If, and Camille and Janelle, you help me with this flow chart or with this image of like, if we can broadcast to all parents and caregivers that protective relationships can stop bad experience from becoming life trauma, then parents and caregivers will increase trying to shield and support their child through traumatic events, right? So if I understand my ACEs impact, my trauma, how do I prevent that from passing it on to my children, right? Then my children will experience trauma in a less impactful way, right? And then children can focus on learning and engaging in relationships, right? When we have all those protective factors in place, when we address, and I love this, Chair Burke, is like the dose, right? Doses of treatment, doses of love, right? Like, I think I was using it, the, daily dose of safe, nurturing, and healthy. And so if we can actually translate that to basically, you don't have to go to a pharmacy, the ability to actually provide this dose of whatever it is to disrupt this to parents and say, okay, it's accessible, we can change systems, right? It's very clear, you all know, you also had a very clear direction for us to, excuse me, to try to embed equity in a conversation, right? We wanted to say that through this process that metrics are actually measured in every single thing we do. We were struggling, I'll be really transparent and direct, is that we wanted to measure everything. But we struggled with this. What is this one metric? And we thought, no, we have to actually step back a bit because everything has to fold into that large North Star. And quite frankly, that the equity conversation needs to be in every single metric, every single investment, every single thing we do, right? And to that end, and we'll talk a little bit later in the slide, we also, the Strategic Planning Committee also asked a really good question. Commissioner Jimenez said, we actually have to have the same understanding of what equity means, right? Is it, and how we get there. So that's a little bit of a work in progress. Next, please. And then, so we came up with this, this orient, so this is setting a North Star, right? So our core North Star, we believe to be, listening from the retreat, is that protective relationships can stop that experience from becoming lifelong trauma, right? So it's not academic, it is understandable, it's reachable and translatable, right? I was telling to Camille, it's not just, when you simplify and have a mainstream message, it's actually easy to translate to other communities who may speak different languages, like my parents and my cousins and my family, right? So when I look at this, I like, okay, that makes a lot of good sense and easily translatable into different communities. And so, yeah, I love this concept of like something as handle with care or handle with love, right? Like the things that we should actually just continue to do. I don't know, I spoke a little quickly. I don't know if folks have questions about that before I hand it over back to Janelle for discussion. I'm feeling a little bit of pressure because Janelle has to leave us in a little bit, but I can try to put on glasses and look like her, but I'm not as great of a facilitator as she is.
Well, Jackie, you did a great job, and I think give everyone a sense of the tremendous amount of thoughtfulness that's been pursued in the last 3 weeks by staff. This is a great moment for us to just ask for your reactions. And I think what we'd like to do in all of this is get to the point where you're providing yet another round of essentially directional feedback to the staff so they can come back to you at the June meeting with a more complete framework. But I think what you're seeing here is an attempt to fill in what was a notable gap, right? Is the notable gap of, are we really connecting with this message? Are we seeing all the issues that you care about somewhere organized, finding a way to organize it? And I think, again, to the metric point, one way that we talked about it as we were preparing for today is pick anything and ask yourself, if I cut the gap in half or I got to 95% of a goal, let's do that, right? So it was less about let's find the exact number, the thing, but is this worth doing? Is it worth saying, can we see ourselves closing a gap and or getting to a deep level of involvement? So I'll turn it over to you and see your reactions, and then we can work towards your direction.
Well, thank you very much for that excellent presentation. I'd love to open it up for commissioners for any questions or comments.
I did that great a job.
Commissioner Hazen?
So I am really excited about what we saw on that last slide. I don't know if theory of action is the right way to describe it, but for me, I think it is really spot on in terms of what we need to do, I think, to drive the impact that we collectively seek. And I like how clear it is. So I think, Jackie, to your point, we need to make it really easy for everybody to understand. It's very easy to understand, and I think it's exactly right.
Thank you. Additional comments? Commissioner Alvarez?
I'll share that I really appreciate it too. I think, especially with all of the attention, frankly, Chair Burke-Harris, that you've been able to bring this issue. But this goes like one step further and really is bringing in families and parents to own it themselves, right? Not the providers, not the system, but families. And I think that's just a tremendous opportunity and responsive to a recognition of community voice and community leadership and their own agency, right? The one thing that gives me pause, and I'd love for us to think about this, is like, children are part of families and families are part of communities. And the circumstances in which a child grows up is out of the control of a parent in many cases, right? Particularly with systemic racism and the many structural barriers that we know confront families. So I'm all in on a campaign on engaging parents, but can we have the wraparound pieces that also seek to address those external conditions that we know marginalize many of our parents and limit their capacity to actually be able to do this? And I don't exactly know what that looks like, but in thinking about our research agenda and thinking about other partnership opportunities or funding streams that we have, how are we supporting the conditions in which our children are raised, and that parents raise children, or parents and caregivers raise children, is what's sticking out in my head. In addition to obviously equipping parents to be able to support their kids through traumatic events. I hope that made sense.
It does. It makes a lot of sense. I have lots of thoughts, but I'm trying to be a good facilitator. So if anyone
it looked like, Chair Harris, that Camille, Commissioner, Executive Director Maven may have something to say.
To that point, we had a lot of those conversations as well. And I think if you look at the slide where it called out the if this, then, the last then was really what we saw as the ultimate North Star. But who that first if was would change. And maybe the thens in between. Because you're right, this is work that we want to talk about policy. We want to talk about, as you said, research, evaluation. And so as we look at that, if the if becomes more specific to the audience we're addressing, so then the if is that, then what are the things that may happen in between to finally reach that final. So what are the strategies in the shades of purple that will help us go towards that direction in the golden column? So I think we're thinking about Amira as you know, there will be strategies, as you said, that stretch beyond, that encompass more of the work we do.
And I think just to add to that, one thing that we had surfaced is there might be many ifs that lead to similar thens, you know, in the sense that if we're being coherent, this all weaves together in a really focused way. And that's one of the values of having that North Star type of focus or statement here, which is as we orient to that, we find ourselves understanding connections of many things that are part of that. So I will turn, we have a few commissioners with hands up. So Commissioner Jimenez and then Commissioner Majors.
Thank you. I'm in a similar position with Myra in terms of trying to get to that, knowing that I feel like the if and then is very individual. It's very individual centric. And so again, I feel like we're shifting the blame and the responsibility on the individual and the family when we are really products of the systems, the communities that we reside in. And so I totally agree, right? Protective relationships can stop. It's very important. You know, what are the resiliency factors? Do our children have them? But I'm trying to understand what our role will be in really transforming those communities, those systems that really then will create the opportunity for our children and families to develop those protective relationships that we know will help them to achieve better outcomes. And I don't know if that comes like in the next piece in terms of like looking at, you know, the socio-ecological model and then helping to identify what strategies need to be implemented by whom. And really, I mean, I see a state level commission more focused on the outer spheres, like the policy, the systems change. And then what is the role of the First Five Association in this? What is the role of each of our local First Five commissions? Because collectively, and it's not just, it goes beyond First Five, right? Social services, public health, et cetera, to really ensure that we invest appropriately and collaborate across all of our systems to really help achieve the best outcomes for families. Knowing, you know, going back to, I saw in the preview for the next slide, I mean, going back to that concept of equity and really what does that mean? And what does it mean in terms of deployment of resources to help achieve equity goals?
Thank you for the comments and provoking the thinking here. Commissioner Majors and then to Chair Burke-Harris.
Thank you. I also really appreciate the presentation, the thoughtfulness, the sort of taking all of our conversations and synthesizing it into this space, because I think it's this reality for all of us that we have so many goals and priorities. We're trying to solve so much. And that was a reflection of that to me. And so these are just thoughts that I have as we think about realistic strategy, which is balancing our impact today, impact tomorrow. I mean, I think we're constantly balancing, you know, oh my God, it's an immediate issue. We want to deal with this now. And then sort of this catalyst of systemic change that we want to be part of. I think for me, there's definitely an understanding that, you know, within our sphere, we can't change every community or, you know, every circumstances, but what are those things that we are able to do or set the groundwork for the future? And even as Myra was talking, I totally agree with her. But it was interesting because I was thinking of her sort of, it's not chronology, but I think our task is children. Our task is children. Children have parents. children and parents live in communities. So it's almost like you could look at it either way, you know, and we can take it from all kinds of different angles. But, you know, for me, and I'll just have to say, I shared with a group a couple of weeks ago, not a couple of weeks ago, I'm sorry, must have been last week, a picture of Dante Wright's son. Being held up at 1 year old, looking at the law enforcement and the tears. And I remember thinking, we've got all these problems in this picture, but my problem is that child. That's my charge, is to figure out that child's future, that child's experience with the trauma they've already experienced at 1 year old. So again, understanding what our focus is. The last thing I'll say is, you know, how do we create with all of this? Because I think it's amazing. And I still think we're left with this very interesting challenge. So I'm looking forward to hearing the rest, is how do we create these realistic goals within our sphere of influence? Funding, expertise, and partnerships, because we understand that we are not the answer to all, but we could be part of the answers to all. And what is our direct work? What is our influence? And what are partnerships that we will cheer from the sidelines? So I do want to thank you guys for all of that. It was nice to see all of our thoughts come to this one space.
Thank you. Chair Burke-Harris.
Thank you. I'm so excited. Ooh, my blood pressure is pumping. And I'm really in agreement with everything that everyone has said so far. There's one point that I do want to say in going in, as I look at the statement, protective relationships can stop bad experiences from becoming lifelong trauma. The only kind of friendly amendment that I might recommend might be just to change the language a little bit to say that protective relationships can stop bad experiences from harming lifelong health and development, right? Just because some folks have a picture of what trauma is, right? But when I think a lot of people actually don't know that we're actually talking about effects on health and development. So I think that would be one piece to help it be a little bit more concrete. But to speak to the questions that Commissioner Jimenez and Commissioner Alvarez raised, I am so down with this. I'm like so excited about this, because I do think that when we have the North Star, and then when we've done such a great job of documenting what our levers are, right? And for me, I always think in the context of, okay, we have our levers, we have essentially our toolkit, and what are the things that we're trying to accomplish, and which tool or which lever do we use for which item, right? So for example, when we're talking about education, we're talking about, we're educating, if we think about something like a public education campaign, that is a tool for educating family, individuals, families with kids, etc. But it also is a little bit of sprinkling the fairy dust, that at the same time we're educating policymakers, right? We're educating grandparents, we're educating educators, we're educating law enforcement, because they can't help it, right? Like it starts to seep in. So it really kind of creates that fertile ground. But then when we're talking about advocacy, I do think advocacy is the place. That lever is for addressing the systemic determinants, right? Advocacy, when we look at this binder and it's got all of these bills at the end of it, right? And there are bills about reimbursement and healthcare coverage and mental health coverage and school-based services. And I think there's one in there about universal basic income, right? Like UBI, right? Like that's where we get to the conditions that give rise. And I think that is because when we're talking about shifting those structural conditions, all of us have done the work on the ground for long enough to recognize that you got to go upstream and do the advocacy to change those conditions, which, by the way, is the beautiful thing about First Five, because we're so well poised to do that advocacy, right? And And in addition, we have all these relationships and partners. So what goal do we use that lever to accomplish, right? We have our relationship and partners with our county First Fives. They're delivering a lot of programming on the ground. Like, how are we aligning and coordinating with their efforts to get to that big goal, right? Like, how do we align what we do and what they do? And then again, reputation and brand, right? Like, how are we deploying our brand? What are we using that lever to accomplish? So I think that particularly I think that we have the theory of change that's really focused on educating parents and caregivers, that really drives to children can focus on learning and engaging with relationships, which I think is right on target. And then similarly, I think that we want to think about do the same exercise, right? For, okay, well, what does it take for families to have the support that they need, right? And do the same exercise in terms of how we think about aligning with our partners and what is the North Star that we're driving our partners to get to. So yeah, so that's how I see it. I think this is additive, what we're talking about when we say, okay, well, how are we dealing with that? How are we dealing with that? We're like, oh, you just gotta, I'm a medical professional, so I'm just like, okay, scalpel is for this, give me a light for that, another tool for that, and we deploy the tools very strategically to get to the ends that we're looking for.
That's a great, let's fine tune, right? So let's have the right ideas and then use our best instrument to get it done. Other feedback or thoughts? Commissioner Munger.
Unmute her.
I think you're on mute.
Okay. It all makes sense to me. I have a nagging concern about the heavy reliance on the first thing. The theory of change rests very heavily on getting the word out that this matters, getting the word out that people need it, because that's important. And it is one thing that we have to do. I'm a little worried about how we reach children whose circumstances are so very challenged. Now, the ones who need it most, that group are most, quote, at risk. Sometimes we call them our most promising. Maybe we should think of them. I'm not really sure what we say, but we know these zip codes where the risk factors just pile up. There's violence, there's trauma, there's poverty, there's discrimination, it's just terrible. And it's not like trauma. We've really got it. The trauma crosses all lines. I mean, we've got that. That's part of the message, and it needs to be a universal message. I just wonder if we don't also need to have as a second major push a focus on the kids that really are suffering so much. Because the 30,000 feet message and trying to weave that into the existing, say, caregiver presentations and trickle it out through the First Five network. I mean, I can kind of see how we would do that. But in addition to a big push to do that, I'd really like to see us to do something that's very intentional and protective and high intervention in those zip codes that are really, really difficult. Because, and I think I've said this before, but there's a tremendous tension between systems building, which tends to focus on systems that kind of work pretty well for most kids, most families, help everybody be a little bit better, spread the gain over a lot of things, make the system work marginally better. That's very fine work. That's not, I don't denigrate that work. the kids that need it most sometimes need it most because those systems never work really well for them. The kids are just too hard to serve. The parents are too scattered and impacted and traumatized themselves. And I would just like to make a pitch for us doing both things. Let's do this public awareness and then weave it through all our existing work. And then could we please have also some sort of intentional intervention in kids and families that are really falling through the cracks?
Can I just ask a follow-up question as to what type of intervention are you referring to?
Well, I don't know exactly what works. I just can only tell a story, which is years ago, I tried to get a bill through the legislature to be sure that kids in foster care had priority for early childhood education. And we couldn't get the bill through because the early childhood system, those kids are too hard to serve. The numbers don't work. They screw up our numbers. We can never prove we've done right by them because they continue to have problems. We don't want them. And it traumatized me, speaking of trauma, because I just left that experience thinking, there's a bunch of kids, there's 1,000 foster care babies every night in Los Angeles County. I mean, I just worry that group of kids doesn't get enough attention somehow. And that if we focus too much on universal 30,000 feet or even 50,000 feet, I don't know what we do. Maybe we work through WIC. I don't know what we do. I just know that we need to care, and I'd like to see it reflected in our plan.
So if I can, I'm taking a lot of privilege, but I will say, and other commissioners can tell me if I'm wrong, but when we're talking about those families that are in greatest need, that is the place where the partnerships feel incredibly important. And we heard from Melissa Stafford Jones at the beginning and from several of the first 5 commissioners of, for example, some of the partnerships that are happening through the ACEs Aware program, where First 5 is partnering with healthcare providers and others in the community to really have a system of care that can wrap around. I think for those in the educational setting, it reminds me a little bit of the MTSS model, the multi-tiered system of services, I guess. I don't remember what MTSS stands for, but where there's like universal something, and then there's something for those who are it's kind of step up greater need, and there's something for those in greater need and something for those in the greatest need. The only thing I would say about that is that from my experience of doing this work from the standpoint of a healthcare provider leading multidisciplinary teams for a decade and a half, I think that we see it and we see those kids and those families, and we are all throwing ourselves into it. And I think that it requires a lot. It requires really thoughtful partnerships set up in ways that are sustainable. And I think oftentimes, so that's where I feel like my thinking has evolved to after doing it a fair amount of time, is recognizing how do we set up systems that appropriately serve the most vulnerable without burning themselves up and burning themselves out in the process, if that makes sense.
It makes total sense to me. I think that you, Commissioner, Chair Burkhardt, understand this better than I do. I just can only speak what's on my mind. We're having a frank discussion, and something I don't yet see on the paper. And I just want to say, those who can think about it better than I can, how do we be sure it doesn't somehow get lost? How can we be sure we attend to it? I don't know what the answer is.
Okay, so thank you for the comments. I think this is something I'm pinning as we really need to think about how you deal with system whole system needs, and through that, the connections going back to our levers, the partnerships that have to be there. It's back to Chair Burkhart's your comment. Where's the tool that you use for that problem? So I think what we've identified is it's a good thing you have many, because you need many to get to the breadth of what Commissioner Munger is describing. So let me get to Commissioner Perry and then Commissioner Hazan.
Great, thanks. And I'm agreeing with everything, including what Molly was saying there around striking a good balance. And I also know that there's still more work to do, and you lay it out in the next step slide. So if I'm in any way repeating what you were planning to do next time anyway, I apologize, but I just want to reinforce a couple things. I'm not sure that the North Star statement you have here is truly a North Star statement. And it reminded me that we had talked about a BHAG. Camille brought that up again, which would get more to something that the chair said at our last meeting, which went more to what she's doing on ACEs, which gets to something like increase by 50% the number of children entering kindergarten ready to learn, going really big, right? Population level. But then this North Star statement, then we see then build protective relationships that stop bad experiences from happening, would be a very high level goal that we could measure and build the strategies and partnerships and advocacy around. But I'm questioning whether we got high enough up, if we're as north as we need to be on the statement. And I know we're going to work more on that. Second question was, thinking about our finance presentation today and thinking about our public education outreach meeting last week, where we talked about how, you know, we're embarking on new relationships, I think, with contractors that are going to help us with our voice, help us with our message, help us with our brand. And those things, in some ways, maybe this is really perfectly timed, because that will be a big piece, that kind of really expert effort that we need from an outside person will help us refine whether this is the North Star statement or we need a slightly higher elevation North Star statement. I hope we can pull on the budget to help us see where the opportunities and resources are, pull on vendors, contractors, outside experts to help us polish and refine the way we're thinking about it, so that all of this good work that we did gets, in a sense, sort of made ready for prime time. So I guess I feel like this is such an amazing start. I feel excited like all of you, but I also can see where we have to drill into the details more: budget, messaging, partnerships, and last but not least, of course, we are sitting on the cusp of perhaps another huge federal investment in states, and more opportunities to leverage than we even have right now. And we need to have, you know, people really laser focused on staff around those opportunities and when they're coming, and what we, you know, are we prepared to make the best use of them? So those are my thoughts.
Great, thank you. Commissioner Hazan.
Yes, so as I start, I am still very excited about this. And as Molly shared, it was interesting. It sort of called out for me what I was reading into what I saw, because I think my orientation is around, you know, focusing on, you know, high poverty populations, on, you know, populations who have experienced the most trauma. And so that was what I read into the statement. And I really appreciate Commissioner Munger calling out that it's actually not explicitly there. And so I think, well, that was how I read it. It may be important for us to think about, do we need to speak to that more explicitly, that it's not any trauma potentially, but those that have experienced or do experience the most trauma are who we are particularly concerned about. So thank you, Commissioner Munger, for shedding light on that.
Jackie.
Oh, so Commissioner Perry, thank you for that. I think that for us, we start off with like 90%, 95% of parents who had children 0 to 5 would understand ACEs and then be able to apply buffering. I forgot what we used, like it just would also apply buffer. And so we got stuck right, about what that meant as we drilled down. And so I think for us, again, it helped a lot when Janelle said, and we can put a metric to anything, to Janelle's point, and we will. And I think, and I know that that's part of our next steps in coming back about, okay, this is how we're going to provide a metric to X, Y thing, Z things that include this concept, this metrics around equity, right? What Commissioner Munger and Commissioner Hazen, you're talking about is this equity conversation, but and at the same time, I believe that Commissioner Jimenez was very, very thoughtful in the fact that we all here need to be on the same page of what equity means. Is it poverty? Is it, or is that a proxy? Is it race? Is it HPI? Is it, I don't yet know if we all have a common understanding of how we apply who is the most harmed, who is the most traumatized, right? To apply our interventions, if you will, right? So I think that that's also a very, will be a good discussion. Our intention is to have that in our strategic planning conversations. But again, did not want to ignore the fact that we heard very loud and clear that we wanted a metric that applied to a big, hairy, audacious goal. And that is actually where we started and understood that, okay, we need to step back and kind of find our directional pull first. I don't know if that helps clarify anything. And then using the surgical tools to apply towards the North Star.
So Commissioner Alvarez.
And I know we only have 5 minutes with you, Janelle, so I want to be mindful of that. But just a few points in response to my fellow commissioners' comments. You know, one, if we're going on a big, hairy ass goal, then why aren't we saying all kids in California will enter kindergarten ready? You know, like, let's go big, right? And then you identify the measures, right? So I'm raising the ante, Chris, right? Like, if we want to go big. But to Commissioner Munger's point, and I think a question that we've all been thinking is, that's where we do use the other levers that First Five has, right? Because we're talking about our public education and outreach lever, which is tremendous. But if we have a research lever, if we have this partnership lever, how we have a financial lever with the money that we distribute, how are we baking in equity, you know, Jackie being the conversation that we have around how we're defining it, into our distribution of resources, obviously within the formula, right? The formula of the proposition, but we have the opportunity to lead. So if we want to do a racial equity index of our money, we can do that, I think, right? Like, these are questions that I would invite the strategic planning committee to discuss, to say, where are we putting ourselves on the line to commit to equity through the levers that we have, as our chair so eloquently said. And then the last thing that I will say that I just really do appreciate about the comms campaign is that it goes back to this idea that it takes a village to raise a kid, right? And I think as a society, we talk about this a lot in my day job, we've like moved away from that, right? Like, it's so much about a child and their family and their parents, as opposed to their community and their neighbors. And the responsibility is on all of us. And the opportunity to have protective relationships is on all of us. Every interaction with a child is an interaction that could be positive, right? So that is so hopeful to me. And I just, you know, I'm excited for that element of it and what we could potentially make happen.
So let me try to quickly recap some of what you've all shared, because I think there's a lot here. I'll say, just building off what you just said, Commissioner Alvarez, which is this notion of, you're all here to affect the system, but it's about child within their community, child within their family. And so what I think I've heard throughout what you're sharing is, it is so important that we are, yes, about what it means for children, but it's in context of the system has to be there. And so the other thing that several of you have brought up is, you have very unique levers at First Five, and use them all, but don't use them all at once. And so that's the point of, let's find the right levers to affect the things we need. And one of those that you've called out really clearly is your ability to engage partners. So doing this work is even you solving what it means to build the village. You actually are helping organize that village around some really key things. So what those might be, you know, I think you're finding some resonance within the North Star. Maybe it's not big enough. Maybe, you know, and how do we get to that place where we understand the breadth of what you want to see, yet remain focused on what we're looking for? And ultimately, I think it's, you know, how do you see the whole, the parts, and be able to talk about it? So you've also brought up this important role of the communication, the engagement, and the ability to be agents of that within how and what you communicate. But it's in the doing, right? So this is the other thing that I think you keep coming back to. It's not enough just to say it, we also need to change it. And so how you go about changing it, it's a combination of things that have come across here. Some of which you can directly do, some of which you have to engage others to do, and others of which you will inform or influence. I think that was the term that was used. So I think this is a good point for us to pivot to now what? And what will the staff be taking with your added guidance and taking action to work on between now and your next meeting? So I'm going to turn it back to Camille and Jackie to walk us through the next steps, which I'll pull up here.
You want to talk about?
So we talked a lot about this, and these are just kind of very, very high level in terms of just trying to get on the same page of equity, right? And we have the latest revision of the first 5 California Principles on Equity, revised in 2008. Perhaps the current commissioner was part of that conversation. And then we also have a definition that is a strategic plan value statement. It's updated to, we have a 2019 to 2025, but our mission was created, hasn't really changed since 2014. And so really trying to work through, likely with the strategic planning advisory, on what is this common definition of equity that you all have just really clearly pointed out, even in this discussion, right? Getting on the same page what that means, and how do you apply it to all of our levers, right? And then we will refine and continue to refine the North Star, and hopefully to adopt it with the full commission. And we are, if you all are open, and this is at the pleasure of the chair and the commission, of coming back in June to actually have further conversation with a more, I'll use big, hairy, audacious goal versus something else that is more concrete and clear and achievable. And so, we will, in addition to that, provide you some SMART goals that are quantifiable, that have metrics that are more clear, that would make steps, provide steps towards that North Star. Camille, did I miss anything about next steps?
No, we would reach out to all of you and the people who work with you to find a date in June to come back. We want you to know that we feel the urgency that you all have expressed, but at the same time want to be thoughtful and work this through with advisory committees as well. So we'll be reaching out to put something on the calendar there.
So I think you can guarantee that this will continue to be a lively conversation with much energy, but also the prompting of action. So really so appreciate everyone's work at the staff level, at the commissioners, to put thoughtfulness into this, because it is, I think, the kind of work that changes the work. So I will say that I think we've reached a good point and much to do, and we'll come back with more updates.
I think we need to go for public comment. Is there any public comment, just in case? Oh,
we do have public.
May I just ask a question to Jackie? Knowing that, going back to Myra's, it's going to take a village, and again, our lane is, first 5 at the state level. We have our local first 5s. When you go back to kind of look at refining our North Star, are there conversations that are had with the people at the local level, for example, that are actually doing the work, in terms of conversations with the First 5 Association? Because again, in order for us to achieve whatever this North Star is, we all have to be in alignment. And making sure that we're maximizing the limited resources coming in for this work to assure that we're able to achieve that.
Tia, Melissa Stafford Jones. But Camille, yes.
Yes, so we are in constant communication. We both share back and forth between what the association is doing, which I'm sure Melissa will address, and what we're doing and how that works together. So the answer is yes, we do.
Yeah, in full transparency, we've been in communication. They are also going through their own, as you know, strategic planning conversations. So it's actually perfect, a lot of alignment across a lot of systems and partners.
Do you want us to go to public comment, Chair Burke-Harris?
Yes, please. Let's go ahead and take public comment.
There's Melissa.
Hey again, everyone. We are so appreciative of this, I should say, Melissa Stafford-Jones, First Five Association of California. We are so appreciative of this discussion and this emphasis on establishing a North Star goal that we can all align resources, energy, initiatives, our effort, our hearts and souls, really with equity at the center to really deepen our impact together and have the most meaningful impact we can for young children and families, particularly those farthest from opportunity. And so I think that's how the association sort of comes to this conversation today. And I'm very excited and hopeful and really appreciate the discussion about sort of the levers and the tools, in the sense that I think we have one really important shared tool, and that is the tool of partnership that we use with each other, but with also many other partners, some of the same and some of which may expand our range of potential partnerships. But we also each have unique tools and levers that we bring to the work that I'm very energized and optimistic by the thinking about what might it look like to have an aligned, shared North Star goal that then we bring this fuller range of tools and levers to. So that seems full of possibility to me. So I'm really appreciative of that conversation today. I do think, similar to what I was sharing this morning, I do think we really appreciate the conversation around this combination of how do we both align and combine? And in my mind, I have to say, I'm still processing through, is it really separate to think about systems approaches and community-based strategies and thinking about those children who face the most structural barriers to health, well-being, and opportunity? Like, I understand they may be some different bodies of work, but in some ways, I also wonder, is that actually the same work? Like the idea of targeted universalism comes to mind for me. We actually have this big goal for all children, and then we recognize that we may need some approaches and strategies that are different for different groups in order to help move all children toward that big shared universal goal that we have. So I do think one of the things we hope to bring to the possibility of potential partnership around a North Star goal would be this orientation to a systems approach, and to Commissioner Munger's point, not a systems approach that says, how do we sort of make the system work better for those whom it already might work fairly well, but actually, how do we really think about our systems work for those who are the farthest from opportunity and who are facing the most structural barriers? What is called upon us to do that? Because I think in order to really take action toward the equity that we seek, that is incumbent upon us to take that approach. And I think for First Fives, one of the things we are increasingly seeing at the local level about our role is it's not just work within certain aspects of early childhood systems. It's not just early care, education, and learning, not just health and development, not family supports. There's a critical body of work for us to all do together that I think First Fives are finding their sort of long-standing backbone collaborative role is helping to play in their local communities, which is we have got to work at crossing and connecting these systems together. And that is going to be critical to, my guess is whatever big goal the State Commission might choose and that we might hopefully get to be a part of is probably going to take that kind of cross systems integration. And we're on the cusp of that work and doing it, but I think there's so much more to be done in that area. As Jackie mentioned, it just does happen to be that the association is in the midst right now of a strategic planning process. So in some ways, I feel like we're having very parallel conversations. We are having conversations about what are our top biggest goals? How do we maybe bring more focus and intentionality and all of our align our work in stronger, more impactful ways toward those large goals? How do we utilize our partnerships? So, and really bring what we know is a holistic whole child, whole family framework that we know is critical. Talked about earlier with the pandemic, we know we've got to keep that framework. It's the right framework, but to within it, really identify what are the 2 or 3 things within that framework that in this moment, in this context, with these opportunities, with these partnerships, we could focus on more deeply to really try to make that whole child, whole family approach real for our children, for our families, for communities, and for the systems that surround them. So we are energized by the conversation, appreciate it, and really look forward to working in partnership.
Thank you so much. That was fantastic. Commissioner Fitzgerald? I think, is there additional?
Yeah, sorry, I just had one additional thing, and thank you for what you said, Melissa. I kind of want to amplify what Commissioner Alvarez was saying about the concept of the village. We talked a lot, obviously, completely focusing equity and how do we interrogate school readiness. We've talked a lot about that, but her comment made me think about the ways individualism is a characteristic of white supremacy, right? And to think of the collective or the village is a way to begin to sort of dismantle that. And as we have this huge, goal, North Star goal, can we do it in a way that decolonizes our own practices that we have that are basically founded in white supremacy, right? So I really think that there's a lot of opportunity. I think language matters, how we use the research matters. But I just wanted to emphasize that because I think it's such an amazing opportunity.
Thank you, Commissioner Fitzgerald. And it looks like we have additional public comment. Francine?
Good afternoon, Commissioners. Francine Rod with First 5 Monterey County. And I too want to really thank you for this opportunity to work together and to collaborate together. I have been around for a very long time, since 2004. And so I have seen the different iterations of what has happened with the commissions in terms of the level of coordination, collaboration, communication. And we have a really great opportunity right now with new faces on the State Commission, with new faces on the leadership of the staff at the State Commission, with new leadership at our association. And so I am really, really, really hopeful that when we say that we are going to collaborate and communicate and work together on these things, that we really mean it in a deep way, because we will not be successful if we don't. And so that will mean trying to figuring out intentionally a process where the county commissions, whether it's executive committee or whomever, is really involved in this communication and this discussion together with you all, because together we really are going to be better. And I want to say amen to what Monica just said, Commissioner Fitzgerald just said, because a number of you, of the other commissioners who've talked about the systems approach and moving it away from individual responsibility and accountability and more toward collective and away from some of this dominant culture language that we have been using and where we need to go. I appreciate in the Surgeon General's report, actually on figure 13 on page, it's either page 180 if you're online, or the actual page number is 146, where there is really a holistic kind of systems approach framework. And you can see it's not really linear, it is integrated. And that's how our families are and how they live their lives. And I'm hopeful that whatever we come up with as a theory of change, as a North Star, that it really encompasses a whole family, whole child approach that really centers race, equity, diversity, and inclusion. And we're really excited to work with you all and are so glad that there are members of the state staff as part of the team that's looking at the READY work. So thank you for this opportunity.
Anybody else, Chair?
Thank you so much, Francine.
That's all for public comment.
Okay, great. And with that, if we want to take a few minutes to take another short break, I think we're doing really well. How about a 15-minute break, and we'll reconvene at 1:30? Sounds good. All right. Thank you so much. Are you with us? We can restart, we can resume, hooray. All right, and we're back. And now we're moving forward to agenda item 5, the strategic plan data digest. I think this was certainly an agenda item that I was very much looking forward to. So I'm happy to turn it over to Camille to start us off with this item.
So we're, okay. Thanks so much. And we're excited to be talking to you about the data digest and the work that we've been doing. You know, and listening to all of this and trying to think about or to express how committed we are to using and improving how we use data to identify and address inequities, advocate for just and fair policies, and maximize our investments to eliminate disparities in order for all families to thrive. It's what we've been talking about all morning and this afternoon, and so this just builds on our earlier conversations. So right now we're going to talk about this emerging body of work that staff and the Strategic Plan Advisory Committee have been talking about and working on over the last few months. This work is really well aligned, we believe, with the direction you provided at the retreat, and we're pleased to have this opportunity to talk to you and pick up on some of the threads that we left off a few weeks ago. In particular, the development of the SMART goals will help determine which outcome metrics are included in the data digest. We will also need to think about how we look, as we said before, and Commissioner Jimenez asked about and talked about, we need to look at our investments to show which outcome metrics they are intended to impact. So in a moment, you will hear from our colleagues at Child Trends, who are helping us develop a framework for the data digest. They also bring considerable expertise on the types of metrics we may consider. We also have our colleagues from the Glenn Price Group joining us today, who are helping to facilitate internal conversations with staff to clarify the intended purpose and the design of the data digest. They are helping us explore those questions with the Strategic Plan Advisory Committee, and we're looking forward to getting initial input from the entire commission today. GPG will also be supporting us to engage other First 5 California stakeholders on the data digest as we get further along in the development process. I will say that on our core work group, the First 5 Association also sits with us and has almost from the very beginning. So with that, I'm going to turn it over to Child Trends to give us an overview of their work, our work to date. So Dale and Kelly.
Wonderful. Thank you so much, and thanks for having us today. Let me share my slides. Does that look the right direction, or should I flip them around? You all can see them okay?
Yes, thank you.
Excellent. Sure. Thanks. All right. Hello, everyone. I'm Dale Richards and part of the Child Trends team working with the First Five California staff and GPG on developing a framework for the Data Digest. So today I would like to just walk you through our current thinking about the Digest and how it aligns with the strategic framework that's being developed now. So I know this framework was just presented, but just to circle back to this as it relates to the Digest. So with the North Star that you all are working on right now, and on the right of what you're hoping to achieve, and then moving left, what are the child and family outcomes that First Five California is hoping to impact, thinking about those SMART goals and how the investments and activities of First Five California lead toward supporting child and family outcomes. So we understand that the Data Digest is really a work in progress, especially now given the work happening with identifying the North Star and those SMART goals. So what we're going to share today is the team's current thinking about the Digest, but we do understand that this may evolve over time. The primary purpose of the Data Digest is to provide data to the Commission to be able to examine progress toward meeting the goals and supportive strategies that have been outlined in the strategic plan. And when we think about the intent of the Digest, it should be able to, one, track progress through a set of metrics that align with First Five California's work and the anticipated outcomes and the North Star, having that explicit focus on equity. As well as being adaptable. So that should those priorities or focus change, that there can be new metrics or new data that are added, for example. And it's intended to be an internal tool for staff and the Commission, as it also can help inform the work of First Five California staff. So why is this Digest important to have? Having this set of identified metrics, and we'll talk about that in a minute, it can help both staff and the Commission look to see if those investments being made are in fact improving access to service for the intended populations and making those needed system level changes. But in order to do that, there needs to be an explicit focus on equity, which I know you all were talking about earlier as well. We're noting equity here very broadly because we understand that the Commission and staff are working to define what equity means and how that impacts the focus of the Data Digest and the associated metrics. So that was sort of a high-level overview about the purpose of the Digest and why it's important, but I want to spend a little bit of time now talking about some of the things that the Data Digest will not be able to do. So the Data Digest is really intended to just be one tool and a way to understand the work of First Five California, but knowing that it cannot do everything. So for instance, the Data Digest is not going to be supporting First Five California in using the data to advance equity and make sure the investments that are made meet the needs of the intended population. So it can present the data and the information, but additional support will be needed in how to then use the data. It also won't tell the Commission and First Five staff which investments or activities are or are not working. So to understand really if something is working or not, that really requires conducting evaluation activities and probably the collection of more data. And it won't be used to evaluate individual county performance. Instead, it's really intended to lead to a better understanding of really that collective impact of the investments and activities that First Five California is doing. The Digest is also not designed to include information about every individual investment or every activity, but again, sort of focusing at that higher level intended to capture the work being done. So we're still working to figure out what's going to be included in the Data Digest to capture the work and activities, investments of First Five California, but thinking about this Digest is really at a higher summary level rather than thinking about each and every single investment having a metric associated with it, for example. And we know that there are so many important metrics out there that we can't include all of them. But it's really about being intentional when we think about these metrics and how to track progress towards achieving that North Star that you all are talking about. So rather than being all inclusive, how do you really think about being really intentional going towards that North Star? One of the things that we'll be doing, and you'll hear some more a little bit later from GPG, is to help us think about determining what those metrics are going to be and what should be included as part of this process. We know how important it is to seek input from different groups of stakeholders. So there will be a stakeholder engagement piece throughout all of this to be able to learn more. And again, just noting that it's not intended to be public at this point in time. It's really meant to be an internal tool that could evolve over time. But right now, then that just depends what First 5 California staff and the commission would find useful. But just noting what it won't do at this point in time. All right, so just to give an overview of what kind of metrics we're thinking about right now to really help measure and track the progress, we're conceptualizing having 4 different types of metrics, as you can see listed here, and I'll go through them. And then sort of describe how that works with the framework that you all had been showing previously. So first, thinking about what we're calling output metrics, and those are really around measuring metrics that measure the amount of funds being invested and the number of activities or efforts being conducted by First 5 California to improve those child and family outcomes. So those kind of metrics we see aligning with a common set of activities, again, thinking sort of higher level with those summary activities related to the supportive strategies in the strategic plan to really show how First 5 is funding and working with counties to support children and families. So that can also include things like lobbying and advocacy strategies, really engaging and moving the field. So what are the investments and activities? Those are the output metrics. And then thinking about access metrics, which is really who, so those children and families, who's being served, who's being reached through these First 5 California investments and programs and policies. Thinking about that at the different levels and thinking about different intended populations, if they're being reached and served. Again, focusing on equity, which we know still kind of needs to be defined about what that would look like. But broadly speaking, thinking about the access metrics as the who. And then system change metrics, thinking about how to measure those system level changes from the First 5 California activities that can impact outcomes for children and families in the long term. So really focusing on changes at the program level, services, provider level. And then lastly, outcomes metrics. That's the measuring at the, measuring at the population level. Both, and when we say population level, thinking about the population of children and families being served both at the county and state levels to really examine those bigger overall changes in outcomes. We really think about those outcome metrics as being tied to the different priorities in the strategic plan, in particular to the North Star, so that outcomes work, and knowing that they're really intended to measure and track changes in outcomes, but also with the recognition that there's a lot of other work being done in California, other efforts, other contributors to helping to move that needle. So these are kind of bigger level outcomes to think about, but how those the work of First 5 California is helping to help move the needle with those outcomes. So let's just go back to the strategic framework visual and sort of see how they align with the framework and where we're envisioning this. So we're envisioning the output metrics, again, those measuring the amount of funds being invested and the activities being conducted, would be related to that orange circle, the theory of change and the actions that First 5 California is engaging in. And then if you move over to the right-hand side and we think about the outcome metrics being aligned with the child and family outcomes, the blue box and the goals of First 5 California and the Commission. And then in between those two, we see the access metrics, measuring who's being served or reached through the work being done. And then the system change metrics, thinking about what system level changes are happening as a result of the First 5 California investments and activities. So that's sort of how we're thinking about lining it up with the strategic framework. I mentioned this earlier, but at this point we haven't selected any of the individual metrics. We wanted to step back and sort of say, what are these different types of metrics that could be included that align with the strategic framework? And also, in order to start selecting individual metrics, we know that several things need to happen, which is identifying the North Star, thinking about those SMART goals, right? All of those things should really be driving some of these decisions about which metrics get included, as well as clearly defining equity. We know that that's really important to define equity for the strategic framework as a whole, but it will also drive decision-making around what data will need to be collected and reported on consistently, and how do we think about consistently collecting and presenting and using data across all of those metrics. So for example, if we're looking to the digest to give us this higher level understanding of the work being done and the progress being done, it'll be important that equity is not only defined, but we're thinking about it in a consistent way across all of the metrics, so you can really measure and look up at a higher level. And as I mentioned earlier, it's really important to engage stakeholders in this process to really help prioritize which metrics to include and which data to collect and use. So thinking about that stakeholder engagement throughout the process. One of the other things that we've thought about when we think about sort of moving forward and selecting the metrics for the data digest is, to the extent possible, and if it's relevant, trying to leverage existing data or data collection activities so that you're reducing burden and duplication. So keeping that in mind as well. And as I noted earlier, while the data digest can be a great tool to measure and track progress at a higher level, there are also other ways that First 5 California can measure the impact of their investments and activities. So these are just some examples here. It could be information provided in the First 5 California annual report. It could also include counties being asked to collect additional data about specific investments if needed, or conducting specific evaluations, or First 5 California could conduct specific evaluations on different activities or investments. And it could also include additional analyses of existing data, such as if there's survey data that are already being collected, other things about thinking about diving deeper into some of the data that we know is already being collected. So I'd like to now turn it over to the Glenn Price Group to talk about some of the stakeholder group work.
Great, thanks Dale. Hi everybody, nice to be with you today. Aaron Price at GPG. And as Dale mentioned, just gonna talk for a moment or two about how we're approaching engaging stakeholders to inform the data digest work, and then want to open it up for any questions or comments, both on the presentation that Dale just gave, as well as a couple of focus questions that we have at this point. As was mentioned, it's in the early stage still, and there's other moving pieces that we don't want to get out in front of, but we do have some questions that we think are ripe for discussion today. Overall, we're planning to have 2 phases of stakeholder input, engagement and input here. The first one really to gather direction, initial ideas, suggestions on what the metrics might include, or litmus tests that we might use to determine whether it's a good metric or not for this purpose, just to start gathering that kind of initial set of guidance. And then between that first phase and the second phase, working with Child Trends, the First 5 California staff, coming up with some initial sets of metrics in the 4 categories that Dale presented. And then the second phase is really getting feedback on those, kind of testing them out. Do these seem like the right ones? Are there things missing here? Are there questions? Are they confusing, et cetera? The first phase, that guidance, general guidance phase, is really focused on you all as the commission, as part of that, the strategic plan committee, as well as the First 5 California staff and the First 5 Association. Camille mentioned earlier that the association has been involved in regular meetings that we've been having on this project. And then phase 2 will include all of the above, but also branch out to county commissions, early childhood service providers, and families. And that some of the details around that second phase are to be designed. So we also welcome kind of considerations around how we might structure that. That's the broad brushstrokes of what we're thinking for the stakeholder engagement piece. In addition to questions on the content that Dale covered, the two kind of focus questions that we want to put out for response, reaction by you all today, though you are of course welcome to go outside of these questions, is, are there any specific metrics, particularly at that output, access, and systems change at those 3 levels? We know Dale mentioned previously that the SMART goals are under development, was one of the next steps from the presentation earlier today. And that will go along, those will go a long way towards indicating what outcome metrics we should be including here. You know, are there at those other 3 levels, are there specific things that you have in mind that we should just kind of be thinking about already? Secondly, and this is maybe a bit of a deep dive within that question, and we know that the Commission and the Strategic Plan Advisory Committee have both had discussions about creating systems change, and today's conversation included, and kind of how First Five California and the First Five Network more broadly are enacting that systems change while keeping in mind this frame of children and families and communities. So in particular, interested if there are systems change metrics or ways of measuring systems change that you all would suggest that we really think about. So with that, I would invite Commissioner comments. Again, any questions or comments that you have on the presentation, as well as those questions about specific metrics or things that we should be thinking about as we begin to identify metrics.
Thank you so much to you both for that very thoughtful presentation. It was very, very helpful. And I want to invite Commissioner questions and comments. If I don't see any hands immediately raised, I'll jump in with my question. So it was very helpful to see the way that you all are thinking about it and the metrics that you're using in terms of output metrics, access metrics, systems change metrics, and outcomes metrics. I, of course, come from a healthcare background where we spend a lot of time on quality metrics. And I'm really curious about whether there's been a thought to understand, to think about how we might be able to capture some quality metrics, right? And then in looking at the way my second question is, at the outset of the conversation, Dale, it was very helpful to hear you say, you know what, this is what this data will do, and this is what the data won't do. And I will say that in my vision, coming in as chair, and you know, we had the opportunity in our retreat in April to kind of each of us share our vision, and then I hope that in this process we get to integrate our visions as commissioners in leading this organization. But one of the pieces that's an important part of my vision is when we set the North Star, right? We want to be able to understand from the data that we're looking at on a regular basis where we are on that journey. Are we way off course? Are we, you know, right on the line? How are we doing? And what are the potential levers, right? To what do we need to do to course correct, right? How do we course correct? And so what I've seen of the data so far is that for our individual programs or individual grants or individual efforts, there's an evaluation, which I think is really exciting and important. But I'm curious if there's any places where those evaluations, as you were pointing out, Dale, that you would have to do an evaluation of a program to assess whether or not a program is working or not. But do we have a dashboard where those program evaluations are laddering up, right? Where we can look at the dashboard and say, okay, you know, we're doing the programs, we're doing the program evaluations. We have this larger data here that is coming in and giving us a certain amount of information. And then where is that information integrated to help us then drive the strategic direction for the organization and be able to course correct, et cetera. So those are my two questions. One is quality metrics, and the second is the integration of the data to inform our direction.
Great, thanks, Chair Burke-Harris. And Dale, invite your thoughts, and Kelly as well. I think super helpful to be thinking about those. Quality has come up only so far, really nestled into, you know, for example, an access metric around access to quality. And of course, we would have to be defining, you know, what that means. So I think helpful to be thinking about that as another potential category or something that might be folded into one of the metrics categories. And I know there's been discussion in the ongoing data digest conversations about that existence of that evaluation data. I don't think we've had much discussion of building direct connections, that kind of laddering up, as you mentioned, of how do we bridge that data set of the collective evaluation results of individual First Five California investments and programs. How do we bridge that to the metrics that will be part of the data digest? So I think that's great consideration for us to carry forward as well.
Yeah, and I think too, just to add to that, these are great questions, thinking about, can some of the quality metrics fold into the systems change piece, and are we seeing systems changes related to programs and services? But I want to make sure I'm understanding you clearly too, when you talk about the different quality metrics. If you think they could be sort of plugged into these different metrics related to who's being served, and but really with the systems change, what's happening, what are we seeing related to changes in program quality and service quality to drive those outcomes? But is there another piece that we may be needing to think about related to that?
Is that a question back to me?
Yes, sorry. Yes.
Yes, I mean, I would say that the short answer to your question is I'm not totally sure, because I'm not like in it with the data. I am a great lover of data, but yeah, I don't have enough familiarity with, you know, how we're collecting our data to understand, to give an example of how that would play out. I can give examples from healthcare, but I don't know if they would be helpful. So, but I can think about it more. I'm hoping that there are smarter people than me on this in this meeting. And speaking of which, Commissioner Hazen.
Well, I'm curious, as we think about quality, if the sort of program level evaluations, I believe, and I'm looking to staff, many of them, those are looking at the quality of those programs. Would that address what you're looking for?
Yes.
Or is it bigger than that?
Yeah. So for example, I'm thinking about equity as a central tenet to what we're doing, right? And so when we look at quality metrics and think about what we're tracking and how we're laddering up, there's going to be, in the evaluation of the programs that we are funding, some component to understand, okay, what is the accessibility to our target populations? What is the effect, right? So if we are funding, you know, heaven knows, a home visiting program, right? Does the home visiting program, you know, achieve the same level of outcomes for our Spanish speaking, you know, for the folks they're serving who are non-English speakers, for, for our vulnerable populations, like are they achieving the same outcomes? And if not, why not, right? So that's one piece. And then there's a larger of when we look at, so that's if we're looking at our home visiting program. And then we look at across the board when we're looking at our theory of change and what does it mean if we are saying, for example, that every child will be will be kindergarten ready, right? Every child in California will be kindergarten ready. And so that means a lot of things in terms of, health, well-being, and when we look at equity at this larger place, right? Looking across, so not just at the home visiting program, but now when we take the data from the home visiting program and compare that to the other programs that we fund, for example, our let's see, our public education campaign, right? Are we achieving the same? Are we? For example, when we get consumer data about our public education campaign, do we see that it is relatable and understandable for Californians of all backgrounds, right? So that's taking the equity and looking, are we doing high quality communications to make sure it's really, and then, so then when we look at the equity metric across all of our programs, right? You can see it, my mind gets a little, but when we look at the equity metric across all of our programs, that's going to be an element, a key element of quality in my mind, right? So I don't know if I'm really being clear on that, but it's at the program implementation level, right? And the program evaluation level. And then overall, when we're looking at the strategic direction of the organization, to say, hey, we're doing a great job with, in this area, but 3 out of our 10 programs didn't do so hot when it came to, X, Y, and Z area, reaching our non-English speaking families.
I think that's helpful. And I think that's sort of where my head was, which is, it sounds like sort of doing it at the, what we're at the programmatic level, and then pulling it up to look at it sort of as an aggregate sort of data set to say, okay, where is it? How are we doing on the whole in terms of quality? And I do agree, and don't need to say, reiterate what you said, Chair Burke-Harris, but I was struggling with all of the things that this won't do. And how are we going to answer those questions that this won't? And so how do we have data that ladders up and connects, and how do we bridge the gaps between the digest and the evaluation? So I'm glad you called that out.
Additional questions or comments? Oh, Commissioner Jimenez.
Yes, thank you. Going back to Erin's first question, I think it was, do we have ideas for output metrics, right? Was that your first question? And then the second one was systems level metrics. And I'm kind of trying to balance what was just discussed about quality and how do we assess, right? Just because there's childcare provided, for example, does it mean that it's quality, high quality childcare? And how do you help identify that? Is that more at the program level evaluation? So when I look at our investments, right? And I know that this is by statute that we have to spend, 6% on media, et cetera, which is really where we get the biggest amount allocated, but is it really helping us to achieve the outcome metrics that we hope to achieve? And so when I think of output metric, if I understood it correctly, is really evaluating the amount of funding that we're spending by each of the types and categories. So I would almost envision it, we have 3 major areas as part of our strategic plan. If we pick on home visiting, for example, I'm still very new. So is that under education? Or is that under childcare? Where does home visiting fall within our strategic plan and funding?
So funding, it's the funding, oh, is that, am I on?
Yeah.
Sorry, the funding is a combination, so it's not out of one single pot. The funding for home visiting comes out of, I believe, research and evaluation and education.
So then my question to the consultants are, if we're supposed to be identifying kind of by initiative, activity and initiative by each priority area, and the priority area, it's like, how are we going to be able to kind of track that, particularly when some initiatives fall across multiple priority areas? And so if we just stick with the systems change, I mean, probably one of the goals with the systems change, with the home visiting in terms of the systems change is, are there local home visiting hubs established to be able to assure that if there are multiple home visiting programs, one being the one that First Five helps to fund, and that there could be others. For example, some local entities have a nurse family partnership as well. There's also funding that comes from the Department of Social Services that helps to fund home visiting specific for CalWorks family. And then you have this other home visiting strategy. I would say are all of those three programs aligned, and are communities helping to identify the best program for the family in terms of which home visiting model would best meet the needs of that individual woman, for example? And I don't know if I'm making sense. This is a new way of thinking of things, and I haven't really looked at this. I'm with Dr. Burke Harris. It's like, okay, I could probably come up with examples in my own field, and I'm just trying to kind of marry what I know in terms of measuring impact and how you've identified these various metrics that you want us to come up with.
Commissioner Jimenez, and I think that question of how are we showing in the output metrics the non-trivial number of investments that First Five California has that span multiple strategic plan priority areas. So that's something that's has come up as a question, and we've tossed around some potential ideas for, at a certain point, do you kind of attribute portions of it to those different categories? There's also, as you mentioned in your comment, kind of rooting back in the actual accounts, which is a similar but slightly different framing. So I think there's a little bit of teasing out there, but I appreciate the suggestions around amount of funding, knowing that that's not just maybe as simple as it sounds by priority area, as well as thinking about what systems are in place or would we want to be of measuring the extent to which they exist, such as the home visiting example.
Thank you.
We only can ask them to unmute. No, I just wondered if she doesn't have her hand up in her. Oh, yeah.
Sorry, just another thought that I have. Again, I'm looking at, $23 million in the media, and a lot of that is, the way that I see that is more kind of like individual knowledge. Going back to our whole discussion about, I may know that I need to eat healthy and that I need to be physically active, but I live in a community where sidewalks are not repaired, there aren't safe streetlights, and the park isn't safe for me to take my children. And so I'm hoping that through this exercise, in terms of coming up with a data digest and further evaluating some of the strategies, how could we look at these buckets that we kind of have to live within in terms of our funding, and what are different things that we could do to kind of help influence, social norm change, community level change, systems change that would better aid us in achieving, the population metrics that we hope to achieve through this exercise.
So I do want to think about that question, because I do want to say that it's important that we don't underestimate the importance of media, because advocacy, education is the foundation of advocacy. We can't act if we don't, if there's not a shared common understanding of certain problems, right? And I will say this just from the standpoint of my experience with ACEs, where, you know, what year are we, 2021? Okay, so like, you know, like 12 years ago, 13 years ago, when I would get in a room and talk about ACEs and talk about the things that we needed to do differently, I was like, hey, we need to change policy. We need to work on this. We need to work on that. And people would look at me and they'd be like, what? That's really cute, what she's talking about. No one had any clue. And then I would be like, you know, applying for grants to funders. and people thought I was nuts, right? And then with the increasing level of awareness, and I will just say, this is for N of one, my own experience. One of the things that was fascinating was I was, in 2011, there was an article about some of the work that I was doing around ACEs in the New Yorker magazine. And after that came out, so literally, Vince Felitti, who was the principal investigator on the ACE study, he called me and he said, we have been able to accomplish more after the New Yorker article came out than after the ACE study came out, right? Because people had an awareness and an understanding. So to your point, I think that I think we can know that, like, you have to exercise to be healthy, right? But I think there's a lot of places where some of this foundational knowledge, like a great example. The fact that racism is a risk factor for toxic stress, right? And that when individuals are exposed to racism, it actually impacts their biology and increases the risk for long-term health problems. I feel like that changes the framing for policymaking in terms of how we understand some of these challenges and how we respond to some of those challenges. And so that's all a long way just to say that when we think about what our levers are and we look at public education, one outcome is individual education for individual empowerment. But another outcome is norm changing and setting the foundation for policy change. And if you don't have, sorry, I'll just say this one other thing. I was just listening today to an interview with Andrew Yang, right? Andrew Yang ran for president on universal basic income. Nobody listened to him. He did not win, okay? And you listen to the interview and he was like, everybody thought I was crazy, universal basic income. And then COVID happened. And then it was like, oh, everybody's getting a check for $1,200. And I believe that if Andrew Yang hadn't run on a platform of universal basic income, even though he did not win, I think that he softened the ground for the policy that we now have where everyone's getting a check coming out. And I want to think about where each of our levers fit in a process, right? Like a larger ecosystem of creating change, because it's not the tool itself that may create the change, but the tool in the context of the other tools that we deploy, right? So public education in the context of advocacy and service delivery, all of those pieces, I would think are important.
Well, thanks, Chair Brooke-Harris, for the example, good example, and just framing of how we might maximize that kind of function that would have opportunity around and a responsibility for. I'm not seeing other other hands up and happy to provide a little bit of a summary at this point if that would be helpful. Actually, I see Kelly just popped up here.
Hi, this is Kelly Maxwell. I work with Dale at Child Trends, and I just thought I would circle back to that comment that you had made earlier, Commissioner Burke Harris, about your vision that the data digest might have had more in it. I think that when you develop your North Star, you are then going to think about SMART goals that you can measure, and then you should go back and map your investments to those goals so you can articulate what is it that I'm doing, and is it how do I think doing that is going to change that goal, so that you understand how the collection of your investments and activities are all working. You will also need data to make sure that each of those investments or activities are implemented the way they were intended to and doing what they're supposed to do. So you are going to have a collection of evaluation and a collection of data to help answer questions at various levels. My sense of the data digest from the conversations that we've been in is the data digest is something that will help the first 5 staff and the commissioners at a higher level kind of see snapshot of, are the metrics looking like we're on the right road, like you mentioned, and we're moving towards the North Star? Then you can turn to other sources of information and evaluation to help you dig into that. So, but it is true that the data digest can't have all of the data in there to answer all of the questions, or it would be too intense for you guys to wade through, for anybody to wade through.
Thank you very much. And as you say that, it occurs to me, related to Commissioner Jimenez's comment, that one of the things as we think about our North Star and think about our programs and our levers, I think one of the questions is to this question of, for example, if we have one lever that's saying, hey, you need to exercise to be healthy, that's really important, but someone doesn't have safe sidewalks, can we assess the extent to which we're like, hey, you want to exercise to be healthy, what is necessary for that, right? Do we have that? How do we use the levers that we have to be able to create the conditions, right? Because that feels really important as well. Fantastic. Thank you so much. Aaron, do you want to go ahead and summarize?
Yeah, happy to. And I think that last point also just kind of connects to the MTSS framework that was brought up earlier, potentially, in thinking about how that model operates. I think this has been great to get some input, guidance from you all. Thanks, Commissioner Perry, for the report in the chat as well. We'll make note of that and make sure to review. Overall, are a couple of things that I think are bubbling up in particular. One is this notion of quality, and I was kind of reframing that in my mind a little bit around effectiveness. I think the word quality in the context, particularly around childcare, early care, and education, connects to a lot of discourse and discussion that's underway, and it may connect up with that. But there's this notion, as the explanation in more detailed way unfolded, of are these investments, is this work effective, particularly in an equity context of looking at different populations, and is it effective across those different groups that we want to be looking at, and make sure that we're delivering effective services around. Another idea, and I think this also relates to Kelly's recent comments around how does this connect to the evaluation data? We know that it's not in itself an evaluation, but wanting to make sure that there's some way that we can understand it in relation to the evaluation data that First 5 California does have on an individual project or investment basis. A couple other items. One, this notion that list of things that the data digest will not do, that there may be some important things on that. And so looking at that list and thinking about, well, what is here that needs to happen? Maybe it's not through the data digest, but it needs to happen somehow. And how does that get moved forward? And then finally, some great discussion and suggestions just in terms of how we think about both output metrics? What are we tying that back to in terms of a dollar amount, and how that gets messy in some areas? So just kind of sparking further thinking there, as well as the systems change piece that was one of those initial questions. Some examples of what we might look at. We welcome additional suggestions, other reports that are particularly salient, either in content or in structure, that you think would be helpful for us to look at. Please don't hesitate to send over. With that, I will, unless Dale or Kelly, you have any closing comments here, I think we can return it to you all, and I'll turn it over back to you, Chair Burke-Harris.
Thank you so much. That was a really helpful discussion. I'm glad we had a chance to get into that. And do we have any public comment?
No.
In absence of public comment, we'll move on to agenda item 8, state and federal budget and legislative update. I'd like to welcome Max Vargas to present the budget and legislative update. Please.
Hi, I am Max Vargas today. Max was unable to make it so he had a conflict. So apologies. You are stuck with my face again and my voice. So, but I do have some robust talking points and have been reviewing some of the legislative items. So, so as an update on the 2021-2022 state legislative session, as well as federal policy, I'm not going to go into too much detail, but happy to answer any questions. And remember, I'm still a preemie. This is day 22, but I think I actually 15 days on the job, so or something like that. So I ask for grace and patience. Starting with the legislation, I think you all received a list of the legislation that we were supporting, adopted by the Legislative Advisory Committee. And of the bills presented there, I'd actually like to highlight Senate Bill 2246 by Senator Connie Leyva, which is actually being co-sponsored by ourselves, the Child Care Resource Center, and Every Child California. This actually may look familiar to some of you, as this is a reintroduction of our sponsored rate reform bill from last session. So the methodology for this legislation is based on the recommendations of the rate reform work group convened by First Five California in 2019. And it's actually well aligned with the master plan for early learning and care's recommendations around reimbursement rate reform. The proposed new reimbursement rate structure would increase current rates, improve the state's ability to maintain access and quality, and address some problems such as inadequate teacher compensation by ensuring that ongoing rates more accurately reflect the true cost of care and the cost of doing business. SB 246 passed out of the Senate Human Services Committee with a 5-0 vote on April 6th, and is slated to be heard in the Senate Appropriations Committee on May 3rd. I don't know if folks have any questions about that, but this is an issue that I believe we brought before the commission before. If not, I can move on to the budget updates. We've actually seen a projected budget surplus, and as many of you know, and a leveraging of federal funds by the state. In late February, Governor Newsom signed a package that provided a few things of interest to us. Many of you were involved indirectly to individuals and families, also known as funding for the Golden State Stimulus, one-time Cali ITC payments, including those for ITIN filers, right? So addressing the needs of our employees who are undocumented. Also, there were additional resources for childcare, $400 million specifically in stipends for state subsidized providers, funding for food banks and diapers to the tune of $35 million, and small business relief, a $1.5 billion increase for small business grants of up to $25,000, including childcare providers, which has greatly benefited local providers, even in my hometown. So California will also receive support from the American Rescue Plan by approximately $43 billion. And we are engaged in advocacy around the use of those dollars for our families most in need. In that vein, with a lot of federal money on the table this year, First Five California, along with our partners, are pushing a number of budget asks through the lens of a whole child, whole person approach, some of which are new items and are not listed in your item actually sent earlier. In the early care and education space, COVID-19 has sharply illuminated what every working family has known all along, that childcare is essential. California has lost over 46,000, and Commissioner Majors is not on, but we feel this, of licensed childcare slots since the start of the pandemic, when there were already far too spaces to go around. This has always resonated to me is that, as we know in California, we have approximately 2 million children living in poverty. We also have 2 million children in need of subsidized childcare. So you do the math, right? That's very telling to me. So the ECE Coalition has rallied around a multi-year, multi-billion-dollar budget investment to strengthen and expand a comprehensive childcare system. And at the same time, we know that families need to go far behind childcare. A key element for supporting children and families is equitable financial stability policies. Workers paid low wages who are disproportionately people of color, as we know, have been more likely to lose those jobs during the pandemic and to need resources for basic needs. To help workers get back on their feet and support a sustainable living, it is imperative to make our financial stability policies more equitable. I'm sorry, I missed a part of a talking point that we are also advocating for the elimination of family fees, which families living in poverty have struggled to pay. To begin to actualize more equitable stability policies, First Five is supporting two critical budget asks. One, ensuring that California workers can access paid family leave by increasing the wage replacement to 90% for the paid family leave program so that low-income workers can afford to take leave they themselves pay for. As many of you know, the reason we do this is a lot of times the 60 or even the 70% isn't sufficient enough to actually cover the cost. So a lot of working families actually leave that on the table. So even though they pay into. And two, we are also supporting immigrants and families through the Cali ITC by permanently increasing the Cali ITC for ITIN fathers by $100, since they actually don't qualify for the federal EITC, and nor do they actually qualify for unemployment insurance. So when they lose their jobs, there's no insurance for them. There's no real safety net. So there's an advocacy that is needed there. Also formally recognize the unpaid work of caregivers with young children by changing the young child tax credit income eligibility. Right now it's at $1. And we, the proposal is to actually eliminate that dollar eligibility so that all caregivers can qualify for that $1,000 tax credit. In the early childhood mental health and trauma support space, we know that young children and families are experiencing high levels of social emotional difficulties due to the pandemic, including stress, isolation, depression, and they need support. We are supporting the funding of an array of strategies, including early child mental health, dyadic care, and home visiting to fully support the social emotional needs of young children as we emerge from the COVID-19 pandemic, and to build the trauma-informed communities we need for tomorrow. We also have signed onto a continuous Medi-Cal eligibility ask that would make permanent the continuous Medi-Cal eligibility for young children 0 to 5 and for postpartum adults to 12 months after birth. That was put into place during the pandemic. We just want to make it permanent. During the pandemic, children's preventative care rates have dropped below their already low rates, and increased stress has taken a toll on maternal and child well-being. By removing these barriers to accessing Medi-Cal, California can help dismantle the structural racism that undergirds our health disparities and help improve our state's low preventative care rates. And finally, just two last items on the state budget. We were actually excited to see the $5 million in the January budget to provide books to low-income children through the WIC program to improve child development and literacy, and are excited to be supporting that proposal. We're also supporting the expansion of the CDSS diaper bank program to supplement the existing diaper program for over 50 counties that are not currently being served. We will, of course, keep you apprised of developments on all of these items. That's our advocacy on the state budget. Now our federal policy update. Again, very robust talking points. So I apologize if it feels like I'm trying to ad lib. So this was already talked about a bit in the context of the state budget discussion. But your item also includes an overview of the American Rescue Plan, President Biden's American Jobs Plan infrastructure proposal, which includes substantial funding to advance child care infrastructure, and the relevant details of the White House's discretionary skinny budget request. we want to note that Child Care for Working Families Act will be reintroduced today, which is legislation First 5 California has endorsed in the past, and we have endorsed again. The bill would support a transformative mixed delivery system, including childcare, Head Start, and preschool. It would make 3 out of 4 American children eligible for care. As you'll recall, for the last few months, First 5 has been going through an RFP process for a federal advocacy contractor. Through this process, we have not yet found a contractor we feel can meet the needs of the First 5 network and the scope of work. We want to ensure that the the lobbyist we choose is a good fit for the network and can help take our federal advocacy to that next level. We'll be doing some homework and outreach to develop a larger pool of candidates, looking at the scope of our work with our network partners and going back out to bid in the coming weeks. In the meantime, First 5 LA has extended their federal lobbying contract so we can maintain coverage. Lastly, but not, we also have an update on Advocates Day and Dia de los Libros. Before I close, I just wanted to make a plug for First 5 Advocates Day, which is taking place next Tuesday, April 27th. We are actually thrilled some of you are able to join us for these legislative visits and are looking forward to storming the virtual halls at the Capitol. We would love for you to tune into our virtual Dia de los Libros celebration on April 30th. We have some exciting guests, including our very own Chair, Dr. Burke Harris, as well as the first partner. I've also actually heard Camille maybe doing an art project, so we're tuning in just for that. So it's a live event. I hope you enjoy it. This event's going to take place actually from 10 o'clock to 10:45 a.m. and will be live streamed from the First 5 Association's Facebook page. I'll stop there. That was a lot of information and the last item, so hopefully we're running on time. Any questions about anything I've presented?
Questions from commissioners?
Okay.
Commissioner Hazen?
Yeah, I'm just curious in terms of the contract and not being able to find someone or the right someone. I'm wondering if there's any more detail that can be shared. Do we feel like we're close? No, Camille's face says maybe no.
I don't know that we've done more to outreach to go beyond the initial outreach and hopefully recruitment of people who would be interested in responding to the RFA. We met with Commissioner Perry to talk with her expertise and her background to get some ideas there. So we're expanding our reach in hopes of attracting additional people to respond.
We're definitely being more intentional between Max, myself, and Camille about the people we know who do excellent work in lobbying. And my lens is from that equity lens, who does this well, who are they working with and who are their friends. And when we talk about whole child, should we just be sticking in the K-12 federal advocates, or should we actually think of Health and Human Services in a broader firm that actually represents cross-sectional issues?
Thank you.
Happy to also take suggestions from any commissioner, actually, who might know good folks. We are told that former Chief of Staff Anna Leary is also a part of a firm out there, so we may reach out and get her thoughts.
I had a question, and I worry that the other commissioners may know this already, but I'm just attempting to familiarize myself. And so as I was reading the long list of bills, both the ones that that we are supporting and also the ones that are of interest, I'm curious, what is the level of advocacy? There was a subset that you shared that we are kind of pushing, and I was curious as to what does that mean? Like, for the ones that we are championing, what are our activities? For the ones that we are, endorsing or supporting, what level of support do we put behind it? And yeah.
There are, I don't know if you wanted to.
Shana raised her hand.
I was just going to share, I believe, so that information was shared with the Legislative Advisory Committee in an email recently. So I'm wondering, Camille, if we can, would it be possible to share that? So there are for each level 1 through 4, specific activities that are associated with that level. And that was something that Commissioner Jimenez and I have asked. We want to know, what does each level need? So exactly what you've asked. And we now have that clarity. And then the other thing I asked actually is, how do we determine which bills meet the criteria to become a level 1, right? And so I think we have clarity around like what we do when something's level 1, but how do we decide what is that most important? So we're sort of working through those things with Max.
Thank you, Commissioner Nathan. But verbally, if you want to hear what the active level.
You know what, I put in the chat here, so I think we can. This is all I needed to know. Thank you.
Perfect. I didn't know if you wanted it for the record as we're recording, because I'm happy to read them for the record. So
if I may, I did recommend in my response to Max that I thought that adding this language specifically in our bill tracker at the very end or at the very front would be very good. So that way, we remember, well, what does level 1 support mean versus level 4 support? And that way it's in the same document versus trying to find it in a different document.
Publicly available and publicly posted. So for discussion. Thank you for that.
The other request I think that I made was also, let's sort it by level, right? So that we can, track by what's most important to least important. So we're continuing to make progress.
If I may, Chair, going back to, we are really at a very stressing time, but really at an opportune time to kind of further elevate just the disparate impacts of a global pandemic on certain communities. And, it's raining money, so to say. And so, this is really an opportune time to ensure that those investments really make long-lasting impacts in our community. This whole concept of, childcare providers themselves are extremely low income, they're not well paid, and yet they are really the individuals that are helping to shape our future generations. And so I'm pleased to see just the investment in this early care space because it really is the area that we need to invest the most in if we're really going to make generational changes in terms of social, economic, educational, and health outcomes. So I'm thankful to the staff for, really helping to push and sponsor some of these bills and continuing the advocacy so that hopefully we get further investment in this space.
And I would posit the sooner we identify North Star, the easier, the more streamlined recommendations can be on what we should be supporting, not supporting, at which levels.
May I ask, I don't know if it's too much of a burden, but seeing that we have the level 1, level 2, level 3, level 4, is it possible for staff just to send out to the commissioners which bills fall within which level so that we can understand that?
No problem.
That'd
Happy
be
to do it.
Thank you. Any additional questions or comments on this item?
Commissioner Hazen has her hand.
Just a quick one on DIA and the activities coming up in the next week. Can you talk a little bit about the PR or what we're doing to, obviously the work is targeted towards legislators, but hopefully we are then amplifying some of those messages more broadly. Is anything being done, and can you talk about that?
So we're working closely with the association who really has taken the lead on Advocacy Day. So, putting out information, not only county partners and encouraging all of those folks to participate, but then what we can post on social media, and we're looking at doing those. We have done those things, advertising certainly that Chair Burke-Harris and the first partner are going to participate on the 30th in Dia de los Libros, and you know, getting folks to sign up for that Facebook event is. So we're putting the word out as it happens. We'll be putting out on social media and talking about those things. Oh, she's muted.
Chair Burke-Harris, you're on mute.
Yes. And it looks like that's it for question and comments. So are there any public comments?
No, I don't have anybody. No.
No public comments. All right. Well, in that case, I think that was our last agenda item. So we can move towards adjournment. I want to say in summary for this meeting, I welcome any feedback from commissioners, but I do want to say it feels like we got a chance to dive into some of that meaty conversation, to ask about some of the things that we are most interested in, the data, the strategy, how are we getting to where we want to get to? And that's really what I hoped to accomplish in working with the team, Commissioner Munger, in developing the agenda for today. So I'm really grateful for all of our commissioners, to our excellent team at First Five, and to the members of the public who joined us for this conversation. It feels like it was a good one. Looking forward to the work that will happen in between, and then to our next commission meeting, which I believe is in July, correct?
We're looking for June to finalize a North Star statement. So
Okay.
we will get that out to you.
Okay, which will be in June. And then, and with that, I move to adjourn.
Yeah. Second.
Oh, I second. If you need a second.
Yeah.
Okay, all in favor? Aye.
Bye.
Wonderful.
Have a great day.
Thank you, everyone. Have a great day.
Thank you. Bye-bye.
Did I just re-record it? Sorry, Commissioner.
Oh, boy.